right. Good afternoon, everyone. Welcome to House Economic Matters. We're going to get started. Today we have a total of 57 oral witnesses on 12 bills. With that, we will jump in. Senate Bill 306. Chair Vital.
Oh, excuse me. Chair's not moving. Thank you, Vice Chair Crosby and members of the Economic Matters Committee. It's my pleasure to be here today, and I appreciate you hearing Senate Bill 306. For the record, Pam Vital, District 32. Senate Bill 306 is a workman's compensation bill. It's prescription drug and pharmaceutical services reimbursements. Thank you for the opportunity to present this bill. I want to give you a little background about why I support this bill. In 2022, I attended an NCOIL conference with, in fact, Delegate Mike Rogers was there with me, and we learned that most states, 37 of them, had prescription fee schedules for workman's compensation prescriptions. As a retired insurance agent that sold workman's compensation for 38 years, and I sold a lot of workman's compensation, I know how important the cost of drugs are to workman's comp claims. It's more than 50% of most workers' compensation claims. So it's particularly hurtful to our small businesses, but also to our counties. If we can pass a fee schedule, it could save our counties millions of dollars, and I'll go in a little more detail to that as we move along. But then later in 2023, I attended a SACWA conference with our Workers' Compensation Commission, and I learned the commission was then considering a fee schedule like 37 other states. But we heard from a nationally renowned speaker on the cost of prescriptions that adopting a fee schedule would create tremendous savings. But one of the things he said, and this is important, and we'll get back to this later, do not use AWP when deciding on a fee schedule. It is a joke, and it does not mean anything. Now, a lot of you, I think, have been lobbied about using AWP, but AWP has no basis. 15 years ago, when it was used by a lot of states to set a fee schedule, it had a basis, but it has since just become a number that really has no meaning. But anyway, in the end, the Workman's Comp Commission could not come to agreement in 2023. Senate Bill 306 does not tell the commission which fee schedule to adopt. We would not put that in statute because it could never be changed. It would have to take legislation to change it. But the bill does give the commission some guidance and requests that the commission decide on a fee schedule by September 1st, 2026. So they'll have lots of time to study the bill and make a decision on a fee schedule. The guidance allows them to add a percentage to the cost of a prescription for dispensing. The bill also requires that the Maryland Prescription Drug Affordability Board, the PDAB, conduct a study on specific things, including prescribing high-cost formulations and dispensing practices that also increases the cost of workman's compensation. This study is due March 1st, 2026, before the prescription fee guide is due to be in effect September 1st, and they can help guide that study. We all have fee schedules or networks on our health insurance. Medicaid has a fee schedule for prescriptions. Medicare has a fee schedule for prescriptions. Only workman's compensation in this state gets away with charging whatever they want to charge. And our Maryland insurers, particularly our counties, are paying what they are being charged, no matter the price, because they don't have the resources to fight what's being charged. I understand that this committee has received information that AWP is the method that the commission should use. However, AWP has fallen out of favor. It does not represent the real cost of a drug. And if you Google AWP, just a simple Google, you'll read things like AWP is typically higher than the actual price paid by purchasers due to discounts, rebates, and other pricing negotiations. Or AWP is often criticized for being an inflated and inaccurate benchmark, as it can be easily manipulated by manufacturers and PBMs. But the National Average Drug Acquisition Cost, NADAC, is an alternative metric that calculates the average price that pharmacies pay for prescription drugs using invoice prices rather than a fabricated value. I know many of you have seen the Optum Resource Guide, and it shows many different ways to use a fee schedule. Many of the fee guides in the Optum Guide were made over 15 years ago when AWP still had some meaning, although even then we knew AWP was inflated. But there was a lack of other available price indexes. In 2025, besides AWP, there are many other choices for a fee guide. You can have FUL, the federal upper payment limit, WAC WAC, wholesale average cost, EAC, estimated average cost, NADAC, national average drug acquisition cost, or AAC, average acquisition cost. And all those terms are on page 99. If you take the time to look at the PowerPoint I've sent to you, and I know you don't allow PowerPoints in your committee, but if you take the time to look at the PowerPoint, page 19 will describe all those terms. In my testimony, there's an important chart that compares what counties are paying in a cost per fill. So Anne Arundel County is paying an average of $298.07 for fills. Few of you are from Anne Arundel. I know that because that's where I'm from. Baltimore City's paying an average of $217.72 per fill. They've been working to actually fight the cost of the prescriptions. Charles County is paying $200.09 per fill. Montgomery County, $315.67 per fill. And Prince George's County, I think 5 of you here are from from Prince George's County, $465.64 average per fill. This bill could save Prince George's County literally millions of dollars, and the other counties also. So I've included a detailed example of what Prince George's County pays for workers' compensation prescriptions by provider. Take notice of the amount paid over an acquisition price model. This is one county. Prince George's County paid $10,294,373 for 22,108 scripts in 2 years. The acquisition price would have been $2,561. I'm sorry, $2,561,068. There's similar data on all the self-insured counties. Do you want your county paying millions of dollars more than the actual cost of the prescriptions? So you've got a chart in my testimony that breaks down the three mail order houses that you're hearing from most frequently, amount that they're billing, the amount that's being paid, AWP, NADAC, and WAC. It's on, I think, page 3 of the testimony. It looks like this. If you'll take your time and look at it, it'll explain to you what's really happened with the cost of your prescriptions. To be clear, this statute allows the Commission to pick more than one price index to ensure all workers' compensation drugs have a price point. Additionally, the bill allows for a percentage increase or decrease from the price index. For instance, they could say NADAC plus a dispensing fee or NADAC plus a percentage. There will be a chance for pharmacies to make a profit, but it's a reasonable profit, not 60 to 88% profit we are often seeing in the data today. Just to reinforce the issue, let's look at a particular drug that is commonly filled. It's a high blood pressure medicine that's commonly treated in workman's compensation for our public safety employees. So atorvastatin, 20 milligram, 90 tablets. Pharmacy submitted amount is $623.90. AWP is $519.63. NADAC is $2.49. Mr. Chairman, I didn't see you come in. Hi, Chair Wilson.
Madam Chair, how you doing?
Good, nice to see you. WAC is $8.13. Mark Cuban is $11.69. But the cash price, if you walk in without insurance, is between $10 and $38. And Med-Cal, which is what California uses, is $19.68. That's their workman's comp rate. Includes a $7.25 dispensing fee. To be clear, Prince George's County filled various quantities in milligrams of atorvastatin 612 times in 2023 and 2024. Montgomery County filled it 351 times. You can now see how the price differentials add up quickly, and you can see why we need to take action and move this along. Just to summarize, Senate Bill 306 mandates that the Workman's Comp Commission set a fee schedule. We're not setting it, they're setting it. Senate Bill 306 does not limit anyone's prescription or the availability of any prescription. It does not remove any pharmacy from providing medication and workers' compensation. So clients could go into any pharmacy. Senate Bill 306 does not make any prescription unavailable. Senate Bill 306 does save millions of dollars to your counties annually. Senate Bill 306 does provide consistency in prices for all. You should have letters in your bill file from all the major counties supporting this bill. The Senate voted this bill 47-0, and I respectfully request a favorable report on this important bill. Thank you very much. Be happy to take questions if you have any.
Madam Chair. One of the questions I do have is in a letter from the Workers' Comp Commission. It seems that they're troubled by their apparently lack of knowledge, and they're worried that that their lack of public knowledge, i.e., that they would not be able to regulate this, and that would cause potential disruptions in the market. Do you understand their point?
Not at all, because number one, they could get help from the PDAB. Dr. York is very happy to work with them as we set a fee schedule. And once the fee schedule's set, then that's what's going to be paid. In the 37 counties that have a fee schedule, there's not been a disruption in the market.
Sure, and I'm only saying that because it's weird that it's a Workers' Comp Commission. It says information, but I guess that's because you're a chairwoman, because it sounds like an unfavorable. So, did this come up when you were on your side?
No, it didn't. I actually asked them to give a letter of information because they did work on this and couldn't come to a conclusion. I was with them at this conference, and they were all talking about AWP, and then this nationally renowned speaker talked and said, do not use AWP. So they got a little confused and ended up not making a decision at all.
Okay, so, and I know this is just something, I know we're short on time, so I don't want to belabor that point, but I just feel like I want to at least get the Workers' Comp Commission to explain their, I guess, informational / unfavorable, so we can, figure out what we're doing.
Well, I think they were trying to explain that they had worked on it and couldn't come to a conclusion, but there are a number of commissioners that have been very supportive, so certainly, have a conversation with the chair.
They literally just say the words, I believe that both our fee guide committee members and our commissioners, including myself, lacked the public policy knowledge that should underpin any decision that could potentially disrupt markets. For these two reasons, I pressed the pause buttons on deliberations.
They did back in '23, but they do have assistance now. And like I said, Dr. York is very happy to be involved with the PDAB and help. In fact, he's doing part of the study in the bill.
Great. Well, maybe
willingly, he very willingly wanted to do that.
That's some input we'll get at some point.
Yeah. I think at the
apologies.
Chairman, I'm sorry. I think at the time they really did lack the knowledge.
I understand that.
There's been a lot since then.
It's dated March 24th of 2025, though. That's why I'm curious.
But when they attempted to do this, it was 2023.
Oh, no question. I'm just saying they just wrote this letter.
Okay.
And I just want to make sure we've some way to address that, because I understand how important this bill is to you. So I'm not disregarding your testimony or your intent. I just want to make sure that we at least get that issue discussed.
Okay, great.
Delegate Arentz.
Briefly, Senator, on the testimony, we take the value of our fire and police pretty heavily, and 3 of the unfavorables are fire or police. Can you help me with that?
Yes, sir, I'm happy to. And those are not from their representatives. The letters are not from the FOP or from any of the unions. There are several of the firefighters that have been told repeatedly that their drugs would not be available. They've been told that by the mail order houses that are charging the high prices. When you see the chart that compare a number of the mail houses, you'll see how much profit they're making, and they have told these folks that they're not going to be able to get their medications if it goes to a fee schedule, and that's just not true. The Workman's Comp Committee, I'm sorry, not the commission, the Chesapeake Employers is the largest insurance for Workman's Comp in the state, and they've been using a fee schedule, and no one has a problem getting their medications if they're being handled by the Chesapeake Employers.
Okay,
it's just not a problem.
Appreciate it.
Thank you.
Thank you.
Oh, there you are.
Hi, Senator. How are you? Good. I snuck in while you were testifying. Thank you so much. What I want to do is ask a couple questions, if I can have just a little leeway, because I want to make sure that everyone understands what we're all talking about here, and with what you have in your legislation, particularly as it was amended. So I'm sure that many of us here have heard from several of the pharmacy providers, the prescription providers. And one of the things that we have heard is that for the smaller independent pharmacies, that going to particularly NADAC, because I guess their reimbursement rates are so low, that it would end up driving them out of business. So one, if you wouldn't mind addressing that, but then the other part that I wanted to ask you about is in the legislation, you added the PDAB to do a study. I know that you talked about a study or a work group that had been put together before, and they couldn't come to a conclusion because, neither side could come to a compromise. And then you mentioned the PDAB for the listening audience who may not know, the Prescription Drug Affordability Board, and you asked that they would do a study submitted by March and then to have a new fee schedule to be implemented by September. Can you just talk to that, why the PDAB and as opposed to putting together a work group, or why do you think that the PDAB might be better? To talk about basically the prescription cost, pharmacy cost, and then those pharmacies that act as a middleman, I guess, while cases are being disputed.
Phew, that was a lot of questions at one time.
I'm sorry, it was really three.
So, start out, the bill doesn't say it has to be NADAC. Okay. But by the way, the way the bill is worded, it can't be AWP. It needs to be the cost of acquisition of a drug. So there's 4 or 5 different methods that can be used. And it does say that they can add a percentage or a dispensing fee. So a small pharmacy, they don't even get that on a lot of drugs now if they're working with PBMs and PSAOs. But they could have a dispensing fee also. So that will be up to the commission to do that. The study, there's a particular group of drugs that doctors mix, topical drugs, and then dispense from their offices. And sometimes they're charging thousands of dollars for these drugs. Sometimes it's Asper cream and Bengay mixed together, or Icy Hot. It's kind of an interesting, so that's what we've asked them to study, and actually the PDAB had already started to work on that. So they were happy to take this on because it's work they've already started to do. And they have a board, and then they have an advisory board. So they have the people available that could do the study. So that's why the study's in there. They have the people to do it. And as I said, the small pharmacies are not going to be in any way hurt by this. And you talked about some kind of negotiations that might slow down filling the drug?
No, I talked about the work group that was put together before that didn't come to a conclusion because they couldn't agree.
It wasn't a work group, it was just the commissioners.
It was the commissioners.
It was just the commissioners. And I think, as the letter said from Chair Quinn, they didn't have the knowledge or background, but there's been a lot more work done, and they also have the PDAB to help them and can call in. I mean, it's their study. They can call in anybody they want to help them with this. And we're giving them a whole year, actually a year and a half, till September of 26 to come back with whatever they decide should be their fee schedule. We didn't want to say in the legislation, your fee schedule has to be this with this percentage, because it changes. And that's what has happened with AWP. It's gotten stale in 15 years. And it no longer means what it used to mean. And in fact, in Pennsylvania, there's a lawsuit about the Red Book, which is AWP, and judges have ruled that companies can't use the Red Book. So, over time, things change, and we want the Workman's Comp Commission to be able to change with the times.
So just to be clear, the PDAB will do a study. They will make a recommendation for the fee schedule, and then the commission then would adopt their recommendation.
Well, do we ever have to adopt a recommendation exactly as it's part of a study. In the end, the Workman's Comp Commission is going to make the decision if they accept it or not.
Well, in theory.
Yeah, in theory. In theory. So it does say there shall conduct a study on prescription drug affordability challenges related to workman's workman compensation claims. I think look at them as a resource and assistance where the commission before said they didn't have the knowledge to do that.
Thank you.
Thank you very much for your questions.
Thank you, Mr. Chair. Good to see you, Senator Vital and ECM. Quick question. I know you were talking about some of the savings that the counties could reap by taking advantage of, what the legislation proposes. And I know you also spoke to public safety, and so maybe this is piggybacking off of Delegate Aarons' question, but do we know an approximate dollar amount? Because one of the drugs you mentioned was lisinopril, and I'm familiar with that because, I take that. But what those dollar savings would be for some of our public safety folks, because they've been in here a number of times with hypertension, talking about hypertension. So I was wondering what the cost savings might be if this were adopted.
So thank you for your question, Delegate. And there, in the PowerPoint that I gave you, it does break down a number of drugs, and a lot of it is the high blood pressure and erectile dysfunction drugs that we pay for, because that goes along with the high blood pressure, hypertension. Say it again,
Lisinopril.
Okay. So a 90, the quantity is usually 90. They usually fill 90 at a time. The submitted amount's been $111.60. AWP's been $89.10. WAC is $6.30. NADAC is $1.71. Mark Cuban is $11.76, and Medi-Cal's $8.96. So you can see a huge difference on one prescription between $111.60 and all these other ones that are, $6, $11, $9. I mean, there's just a huge difference. And so Prince George's, Charles, Washington County, and Baltimore County pay the pharmacy submitted price, so this will help them save money. Montgomery County and Anne Arundel pay the AWP amount, so it's just millions of dollars of savings for each of our counties. Go back to that chart that I said what the average pay per fill per county is. It's significant.
Okay. Thank you, Mr. Chair. Mr. Vice Chair.
Thank you, Mr. Chair. And good to see you, Madam Chair.
Thank you.
Yes, I think many of us on this committee have been lobbied by both sides. My question is, you had mentioned in your remarks that AWP is not based on anything really. And what you're proposing is the drug pricing to be based on acquisition, right? Acquisition costs. So could you, just for the committee's understanding, explain why AWP has been so prevalent as a practice? Is it simply customary as a market practice? And also, for acquisition costs, is what you are proposing sort of the direction other states are moving toward?
Yes.
Thank you.
So thank you for the question, Delegate Chi. AWP was very popular like 15 years ago, and it's just really changed over time so that it's not, a dependable number any longer. I think in my testimony, I've talked about how it's just become what's being charged, not meaning what's the cost of acquisition. It's what companies are charging. It doesn't need to be NADAC. It could be WAC. It could be AAC. It could be what California's using, the Med-Cal. I mean, there's a lot of different options, but AWP is the most expensive of all because it's just the number that pharmacies want to charge. Other states are trying to change what they've been doing. If you look at that Optum book, which I know you've all been given, it's all over the place. It's AWP plus 15%, AWP minus 40%. The states that use AWP, there's no consistency because the number's not consistent.
Thank you.
Thank you.
Madam Chair, I know you have another bill here. I'm going to go through this one. Then I'll go right back to you. But are you briefing 227 and 219, or somebody here for those?
I am doing, 695, which is my.
Okay. Cool. We got you. I will call up now, I guess, the favorables. Bill George, Carrington Anderson, Carmine D'Alessandro, Michael Daly, 2, 3, 4, 5, Robert Enton.
Good afternoon, Mr. Vice Chair, members of the committee. My name is Carmine D'Alessandro. I'm Chief Legal Officer for Chesapeake Employers Insurance Company. I also serve as General Counsel for the Injured Workers Insurance Fund. The Injured Workers Insurance Fund's President, Ms. Menninger, is with us today. Chesapeake Employers is the largest workers' compensation carrier in the state of Maryland. We have about 20% of the market, including 9 counties and about 150 municipalities. The Injured Workers Insurance Fund oversees the state of Maryland's workers' compensation program. So the 85,000 or so state workers, we oversee their workers' compensation program as well. Here to support Senate Bill 306 and ask for a favorable report. Senate Bill 306 follows the trend that Maryland started about 5 years ago when in the Medicaid system they moved away from AWP onto an acquisition cost. So this is just following the same principles that the Maryland Medicaid system started several years ago. Senator Bidel has talked about average wholesale price. We've talked about states moving in that direction. California has moved in that direction. Massachusetts has moved in that direction. And Pennsylvania, about 15 months ago, as you heard, their court threw out AWP as being unreliable and indicated that acquisition cost was a better approach. And the reason it's a better approach is because acquisition cost, unlike AWP, is actually based on consumer transactions. So those indexes are based on what people, pharmacies, are paying for that medication. In fact, the pharmacies that are opposing this bill will acquire those drugs using actual acquisition costs, but then turn around and resell them at the inflated AWP price. We're just asking that acquisition cost be the rule. The real heart of this bill is what is reasonable profit. If you research what a typical profit for a pharmacy is, it's 20% as opposed to 80%. And I'll let Ms. Carrington talk about some of the numbers.
Thank you, Mr. Vice Chair, members of the committee. My name is Carrington Anderson with the Maryland Association of Counties, speaking in strong support of Senate Bill 306. We thank Chair Bidel for bringing this bill and seeing the need for it. Senate Bill 306 is an essential reform to workers' compensation. It establishes a clear and sustainable fee guide based on actual acquisition costs for the reimbursement of prescription drugs. No fee guide, which is what we currently have, results in excessive and inconsistent pricing. Chair Bidel said the Prince George's numbers, but I think it's worth repeating. So for example, Prince George's County in 2023 and 2024 paid $10.2 million for prescription drugs. The on-the-market cost for that is $2.5 million. The difference between those two numbers is what Prince George's is being overcharged for prescription drugs. One more time, 10.2 for what Prince George's paid. The average cost is $2.5 million. Prince George's is not the outlier here. This is the universe without a fee guide. Workers' compensation is a significant cost driver for local governments, and no regulation results in inflated cost. This is money that could be sent on other critical programming, public safety, schools, and other services. This bill levels the playing field and addresses excessive markups, which drive up costs for local governments, the state, businesses, and ultimately taxpayers. I do want to point out that there are a number of counties that have submitted letters of support from their county executives: Prince George's, Montgomery County, Baltimore County, Frederick County, and Anne Arundel County, and there are plenty of more who are supportive. This bill would provide much needed relief for county governments, especially in this fiscal environment, and this isn't going to change what is filled for employees. For these reasons, we would request a favorable report. Thank you.
Teresa Kuhns with the Maryland Municipal League, playing the role of Bill George today, so thank you for allowing me to be up here. Most of you know Maryland Municipal League has 161 local governments in Maryland, but we actually do more than just advocating. We play a role in managing a suite of insurance options for those same cities and towns, including a statewide municipal workforce of 23,000. Local Government Insurance Trust is a public pool of Maryland's local governments, including primary and excess liability, auto, environmental, property, boiler, and machinery. We also offer a health plan. Municipal workforces have one of the strongest benefits in the state. Part of this role provides me a role on the National Mutual Insurance Board of Directors across the country, representing Maryland with 32 other states. What we don't offer is workers' comprehensive plans. We have found a great partnership with Chesapeake Employer, with over 125 of our cities currently working with them. We anticipate this to save local governments millions of dollars. This is a huge deal for this year in particular, given our own fiscal challenges, the uncertainty from the federal government. We see that having no pricing affordability index has artificially increased those costs to our local governments. In the rare instance, if an employer-worker comp plan has been denied, many of those employees will still have recourse to use those benefits that we already have and provide our members. At a time of federal uncertainty and state fiscal challenges, keeping the cost to local governments lower has a direct impact on our taxpayers. For that reason, we urge a favorable report. Thank you.
Thank you, Mr. Vice Chair, members of the committee. Michael Daly with the Maryland Defense Council. We want to thank Chair Beidel for bringing this very important legislation to you all, and we are asking for a favorable report. A couple of things I just wanted to make mention of. The good news is that the Workers' Compensation Commission already has in place a fee schedule mechanism for all other medical services that are provided to the injured worker and the medical community. You've heard a lot of very important testimony about why we think this regulation is so important. And one of the things that I think is important to remember is that this is an extension that already exists in terms of the fee schedule and the pricing. Yes, there will be a need for information to come from, as the chair had indicated and Mr. D'Alessandro had testified to briefly, to get the information to put together a fee schedule that will be fair and work well, both for the public and private sectors. This is truly a fairness bill. This is to make sure that our counties and our self-insured employers and our insured employers are not being unfairly overcharged for these important services that the injured workers are entitled to. The fact that this statute is structured the way it is a true example of a living law. If this becomes law, it means this won't have to be brought before you every year, 2 years, or 5 years. It will continue to adapt and modify as determined by the market. And I think that's a really well-structured and put-together law. For all those reasons, we request a favorable report. Thank you.
Thank you, Mr. Chairman. Question for Mako. What keeps Prince George's County from paying the 2.5 today? Why are they paying 10.5?
Thank you, Delegate, for the question. I think ultimately counties are paying what they're charged. Counties don't have pharmacists on staff, and really the pharmacists are the ones who are digging into this data. I think counties are more likely to hire public safety workers and have money for teachers than have pharmacists on staff to find this sort of numbers and really dig into the data.
So they can't hire an employee to shop around to save them $8 million a year. I think that would pay for itself rather quickly.
Thank you for the question, Delegate. Some counties, I think part of it, we're really just realizing this year that this is a problem. I don't think that some counties knew that this was happening because, again, we're paying what we're charged. We didn't really realize, I think, in some cases that this was so excessive. So some counties are beginning to fight that, but it is a resource challenge, and hiring more employees is a cost, and we're in a difficult fiscal situation this year, and a lot of counties aren't hiring or have some hiring freezes. So thank you for the question, Delegate.
Yeah, but I think that one's common sense if you're going to save $8 million. MML, you said you're using Chesapeake now. So what would be different under this bill?
Similar to the counties, we would be saving money for our premiums going in and for what we're paying for pharmaceutical. At the end of the day, we certainly don't have.
The bill doesn't stipulate a fee schedule, right? So how do you know you're going to be saving money?
Because there's no pricing index being used right now. If you have a pricing index, I think that's going to save us a lot of money, especially for municipalities who don't have staff, and a lot of our members, the smaller ones, are particularly using this program.
Okay, and the gentleman on the end, I thought you said there was a fee schedule in place?
Thank you, Delegate, for that question. There's a medical fee schedule in place, so meaning all of the medical services that an injured worker would receive, going to the doctor, going to the physical therapist, those are already, there's a medical fee schedule that is published by the commission. Just not on prescription.
Okay, thank you.
Just briefly, how does this bill, if it does, how does it affect my local pharmacies? I have a CVS's, I have the grocery store, and I have the mom and pops. Is there any impact on them?
None whatsoever, Delegate Ahrens. When Maryland moved to the Medicaid system, into acquisition costs, those pharmacies were not impacted. The pharmacies here today in opposition, one is in 50 states, one is in 48 states, one is in 21 states. These are not small pharmacies that are opposing the bill. And in fact, I don't believe the small independent pharmacies took a position on this bill. I believe they're neutral. So I don't believe they're going to be impacted the way that some of the lobbying has been indicated. In fact, Chesapeake, we've been operating as if this bill was passed in 2018. We pay as close to acquisition cost as possible with administrative fees. We don't insure Prince George's County and some of the bigger counties. So we've been operating this. We insure many of the counties on the Eastern Shore, and we have had no issues with pharmacies, independent pharmacies in network.
So no access will change for any of them?
None whatsoever.
Okay, thank you.
Thank you. Since I represent Prince George's County, and that's been the topic here today, let me just ask a couple of questions. So I know that Prince George's County is self-insured, which means that they don't have a Chesapeake or an IWIF, that Prince George's County is actually or should be negotiating themselves, which I think goes to Delegate Wyvil's point. And so they don't have anyone doing that. So basically, because they are self-insured, I'm asking to be corrected if I'm wrong, then they're just accepting what they are being given as far as prices. First of all, is that correct?
Thank you for the question, Delegate. I do think that's correct. I don't think that, again, it's difficult in some situations to know, I think, how excessive this cost is until you really learn the situation, but yes.
So we've heard about PBMs or pharmacy benefit managers, and since Prince George's County is self-insured, and for any other county that is self-insured, they wouldn't have a pharmacy benefit manager who is sort of the middle person, I guess, that would negotiate their prices. Is that correct?
Thank you for the question, Delegate. I don't think this bill would change that, but you.
No, I'm just trying to make sure that I have an understanding and anyone else.
Delegate, if I could jump in, and thank you for the question. I do believe that the self-insureds have PBMs. I do believe that Prince George's County has one. When you're self-insured, you hire a third-party administrator, which you'll hear about in some subsequent bills coming up today, and that third-party administrator will make the contracts with the PBM and things like that. It was Chesapeake that reached out after the fee guide committee hearings sort of fell apart to the counties, and we actually brought this to everyone's attention. So to Ms. Anderson's point, I think it was under the radar. At Chesapeake, we have a doctor, a pharmacist, nurses, so this is all we look at. So, but yes, they do have help in the sense of a PBM. I don't know whose theirs is, but they do have one.
Okay, so one of the things that I've heard from individuals who have come to see me is that we don't know what the PBMs are actually, not so much what they're charging, but what they're acquiring, the cost of the drugs that they are acquiring, because one, they don't make that information known, it's proprietary, but they could very well be getting rebates from the drug manufacturers as well as discounts. And so we don't really know what they are charging. Is that your understanding? And help me, because I'm still learning on the fly. So help me to make sure that I understand.
So I don't
real quick, sir, can you just speak into the mic? We've got
I
a couple
apologize,
people
I
texting me.
apologize.
No, you're good. Thank you.
Thank you. Now, the question just eluded me, but yes, so I don't believe that rebates or discounts are involved, at least with our PBM. What we've instructed our PBM is that there is an acquisition cost, and that's what we're focused on. Obviously, there is profit. If you look over the last 2 years, Chesapeake has paid $4.2 or so million for about 37,000 prescriptions, 4.2 million. Those drugs, the acquisition cost was about 3.5 million. So you can see there is profit there. We paid 4.2. What's significant and why these numbers are important, for the same amount of prescriptions in those same 2 years, if you combine Prince George's and Montgomery County, those two counties spent $17 million, and Chesapeake and the state are the largest operation in workers' compensation, and those two counties spent 4 times as much. But no, I don't believe that rebates and discounts are part of the equation, and clearly everyone is in this to make something. The question is how much that does it become a little too much?
Right. Last question for Ms. Anderson. The counties then, those who may be self-insured and they do have a PBM, those, they could instruct their PBM on just what Chesapeake does with their PBM to say acquisition, plus a small profit, and that's it. Would that be a correct statement?
Thank you, Delegate. Are you asking basically to fight or litigate some of these charges? Is that your question?
No, just not to litigate, but just to dictate. So I'm the county, administrator of the insurance, and I have hired, Howard's PBM, and I'm telling Howard, when we do these prescriptions, then you are not to pay more than acquisition plus, some, appropriate profit.
I don't know the exact answer to that. Carmine could maybe answer better if that would be okay.
So you can dictate, but then the other word there is litigate. So we have dictated, but so far we have over 500 claims that the pharmacies have filed at the Workers' Compensation Commission asking for more money. So we dictate, but then it leads to litigation.
Okay.
So the benefit of this would be that litigation would go away.
All right, thank you.
Thank you.
Seeing no further questions, that concludes this panel. We'll now go to the remainder of the favorables. Robert Enton. Bob, I don't know if you're here or... He's not here. Got scared to testify favorable. Ashley Smith and Julie Murray. You can start when ready.
Good afternoon. Julie Murray on behalf of Maryland Defense Counsel. I'm respectfully also requesting a favorable report on this bill. I am just briefly going to touch on some of what was brought up and some of what you will probably hear again, which is the access to care issue. It's really important to note that this bill does nothing except direct the commission to find a pricing schedule between insurers, municipalities, or counties, and the pharmacies. Access to care is simply not an issue that we see litigated before the Workers' Compensation Commission in any situation where there is a fee guide. There are 37 other jurisdictions that do have a prescription fee guide, and as was alluded to in the past panel, those jurisdictions have not reported any type of issue with access to care. They have not reported that pharmacies are pulling out of their states en masse because they have a prescription fee guide. I think that the people that you are going to hear from in opposition to this on the basis of access to care have been told by some of the pharmacies that there may be a problem, but that is just not something that we have learned other jurisdictions have experienced. The other thing I think that is important to note is that the Workers' Compensation Commission does not permit balance billing. So when there is a dispute between as to the cost of the medication, any cost is not passed on to the claimant or the injured worker in this case. So truly this bill simply brings prescriptions under a fee guide like all other aspects of medical services and does not necessarily have an adverse impact on our public safety officers, our firefighters, or our other injured workers in the state. Thank you.
Thank you, Mr. Vice Chair, members of the committee. My name is Ashley Smith. I'm here on behalf of the Maryland Defense Counsel. I'm going to share with you briefly an example that I shared with the Senate Finance Committee to sort of illuminate the issue that we're dealing with. Let's say you go to Giant and you pay $10 for a dozen eggs. You go down the street, at Wegmans, it's $13 for a dozen eggs. And then there's a guy on the internet, or maybe a guy with a podcast, who says that the price of eggs is really $50 a dozen. What some of these pharmacies do, not all of them, but some of them, come in and they take the price from the guy on the internet, they add 20% onto that, and they start charging employers and insurance companies $60 for that dozen eggs. As a result, you have what is ridiculous amounts of price gouging being done and passed on to the local governments and insurance companies. In this particular case, with this bill, the guy on the internet or the guy with the podcast is the average wholesale price, because it really doesn't have any bearing on what anyone is actually paying for these medications. This bill gives the Commission the flexibility to set prices fairly using acquisition cost as a starting point and then adding fees or profit or a percentage onto that so that pharmacies can make a fair and reasonable profit off of the selling of these drugs. The example that was given that's come up frequently is NADAC. NADAC is the National Average Drug Acquisition Cost. This is data of average prices actually paid by pharmacies to acquire drugs from manufacturers. It is published by the government, and it is a living document. It is updated regularly. So, for example, if the Commission were to adopt NADAC, it would be NADAC plus a fee, or NADAC plus 20%, and that would enable the pharmacies to still make money, still make a profit, while not price gouging insurance companies and the local government and the state. Thank you.
Thank you. Seeing no further questions, that concludes the favorables. Next, we will go to favorable with amendment. Jane Kresak, I apologize for butchering that. Josh White, Darren Thomas, Gil Jen, and Colleen Shields. You can start when ready.
Good afternoon, Vice Chair Crosby and members of the committee. I'm Jane Kresich, here on behalf of Injured Workers Pharmacy. We are a home delivery pharmacy that focuses exclusively on patients in the workers' compensation system, helping them get timely access to the medications that they need. We support SB 306's intent to create a pharmacy fee schedule. Standardizing reimbursement can streamline the system and improve clarity for all involved. But we're concerned the bill would restrict the Maryland Workers' Compensation Commission to using only acquisition costs to set pharmacy rates. That's a problem. Acquisition cost doesn't fully capture what it takes to safely and efficiently dispense medications in the workers' compensation system, which involves more time, more administrative complexity, and higher upfront risk than traditional pharmacy care. Across the country, nearly all states that adopted pharmacy fee schedules rely on average wholesale price, or AWP, or a blended approach that reflects both drug cost and operating expenses. These models acknowledge the realities of the pharmacy space and help preserve access, particularly for smaller community-based providers. When states explored acquisition cost-only models, they were rejected due to concerns about negative impacts like reduced pharmacy participation and delays in patient care. Instead of locking in on one approach, we urge the committee to allow the Commission to evaluate all available models, just as it does with other medical reimbursement rates, and recommend what makes the most sense for Maryland. The approach respects the Commission's role and gives it room to balance cost control with patient access and system stability. Thank you. I'd be happy to take any questions.
Chair Wilson, Vice Chair Crosby, and members of the committee, my name is Josh White. I'm here on behalf of Injured Workers Pharmacy. We have long supported creating a pharmacy fee schedule for workers' compensation, but we're asking for one important change. Give the Workers' Compensation Commission the flexibility to choose the reimbursement model that works best for Maryland. As written, Senate Bill 306 limits Commission to just one option, acquisition cost. That bill applies a healthcare pricing model that does not fit the realities of workers' compensation. And workers' compensation is different. It comes with its own rules, paperwork, and challenges, and that's why comp issues come to economic matters and not HGO. There's a chart in your packet which shows that 35 of 37 states with pharmacy fee schedule use average wholesale price, or AWP, and not acquisition price, which has been rejected by Arizona and Kentucky just recently. That's because AWP better reflects the full cost of care, and pharmacies can survive on one price. They can't survive on the price of the pill alone. They have to cover staff, rent, compliance, and other processing. Insurance companies won't sell a coverage based on what it costs them to acquire a policy. They also build in overhead, service, and risk, and pharmacies should do the same. We're not asking you to choose a fee schedule. We're asking you to let the commission do its job. Study the data, talk to stakeholders, and choose what's best for Maryland. They may land on acquisition costs, but that decision should come after a full review by the Workers' Compensation Commission. Thank you very much.
Good afternoon, and thank you. My name is Darren Thomas. I am the Chief Operating Officer of Easy Scripts Pharmacy. We are not in opposition of a fee schedule. We are a national home delivery pharmacy. We practice in multiple states that have workers' compensation fee schedules. What we are proposing is an amendment similar to what our other panelists up here have talked about. The key that I want to spend some time on here, though, is sort of the misconception of the cost savings that we heard prior. We heard that pharmacies are excessively charging. Pharmacies charge the average wholesale price. My pharmacy charges AWP times 1.2. If I look at Prince George's County, they are reviewing my bill and taking it down to average wholesale price and paying that. They do this through the usage of Sedgwick and Optum, their TPA and their pharmacy benefit manager. They are reviewing the bills. When I look at Chesapeake, they use my matrix as a pharmacy benefit manager. We are billing at a specific rate. They are taking our bill and paying us at a contracted rate, even though I do not have a contract with Chesapeake. Same thing with Anne Arundel, same thing with a lot of the other counties and other insureds that we've talked about. One of the keys that is missing from the previous testimony, however, is the PBMs are not going to participate in an acquisition cost fee schedule. PBMs are not going to do that. Right now, PBMs make their money off spread pricing. They reduce my bill, and the insurance carrier pays them a price higher than what they're paying me. I'm paid directly from the PBM. I am not paid directly by Prince George's County. I'm paid by Optum. I'm paid by my matrix, not directly from Chesapeake Insurance. So the key as we talk about these cost savings is, will they be truly realized if the PBMs in the current construction of the bill are carved out, and will continue to be able to keep those contracts in place and pay the pharmacies at a much lesser rate, which will reduce access to medications for injured workers as participation will drop. Thank you.
Thank you, Mr. Chairman. Gil Jen on behalf of Rescue Meds. I just want to give us a real perspective of the actual notes of the Workers' Comp Medical Fee Guide Committee on this reimbursement issue from their own website. And these comments basically mirror our amendments that are being discussed here. September 23, 2023, Commissioner Kittleman suggested having experts in the pharmaceutical industry share their knowledge with the committee members as well as representatives from the states that have workers' compensation prescription fee guides and share their processes and any issues they encountered. A month later, the consensus of the comments is that most presenters favored AWP versus NADAC. The final meeting at Chesapeake headquarters in November of 23, a suggestion was made to obtain data from surrounding states that have prescription fee guides to compare prescription costs. If NADAC were selected, concern was raised that Maryland would still need to adopt a solution for the 30% of drugs that aren't included in NADAC. Why would you as policymakers pass a bill allegedly to save costs, and it doesn't even address 30% of the drugs that are being discussed here today? The PowerPoint figures are incomplete. It didn't consistently list whether they were brand or generic. Didn't list how much the PBMs were paid by the counties and retained in rebates, one of the reasons for the high figures, for example, in Prince George's County. And it didn't list the defense litigation costs to delay and deny pharmacy access when almost 50% of the cases are contested, but only 5% of the claims are ultimately denied at the workers' comp. We ask you not to be the first state to statutorily adopt acquisition costs. Thank you.
I'm Colleen Shields, founder of Rescue Med's Work Injury Pharmacy here in Annapolis. This bill applies to just 4 pharmacies, as PBMs, pharmacy benefit managers, are carved out. If passed, all 4 will be eliminated. We fill the gap and the scripts the PBM pharmacies delay and deny. The firefighter with cancer, 100% of prescriptions are denied in the first 6 months, but we fill them, and we are their lifeline. If passed, workers will lose access, pay out of pocket, or go to the ER. And PBMs, who already control 90% of the market, will now control 100. The truth is, PBMs increase costs. Big PBMs are being sued by FTC for $7 billion in bogus payments. Chesapeake's testimony is deceptive. It fails to disclose what they pay their PBM scripts. Why? Because it's AWP, and they get a kickback. Another deception. All over, they focus on charges, not payments. Charges are meaningless. Actual payments are what matter. They paid us just $24,000 last year. Their letter says in 2 years they paid 38% of AWP because the rest went to their PBM. They don't want you to know that, or about their legal kickbacks known as rebates. Back to the PowerPoint. Notice their lack of disclosures. Deceptively, Prince George's testimony shows 2 years of data, not 1. They said they paid $5 million a year. If passed, same scripts filled by the PBM pharmacy, $5 million or more. What's the point of creating a fee guide for 4 pharmacies? To eliminate us. And they profit either way, from rebates or, even better, Chesapeake denies so often the patient gives up and uses Medicaid. Then Chesapeake can gleefully build another stadium. They have successfully closed the gap, the 4 pharmacies, and any last hope that an injured worker has fighting the system. It's obscene and it's wrong. Support the amendment and send this bill back to the Fee Guide Committee for real transparency and cost savings. Thank you.
See, one question. I guess before I go to the questions, Gil, I'll target you. Because it seems like the Senate came out after a lot of hard work. Madam Chair, who's a good friend and colleague of mine, is sitting right behind you. What did they miss?
Well, I'm going to defer to Ms. Shields on that.
I won't say this because you were very energetic and passionate about your observations, so I was asking you.
Mr. Chair, what I was doing was literally looking at the workers' comp, because the testimony notes, because the testimony was AWP is out of favor. That's almost an insult to the Workers' Comp Commission that as late as 2023 was looking at AWP. Former Senator Kittleman said, let's look at all the states. And that's what we're asking for in our amendment, and yet the bill comes in saying acquisition cost. We're not trying to impose anything, but you can't look at AWP. Well, I'm sorry, that's an imposition. You're not looking at the full spectrum of what 35 other states have looked at and examined. And specifically, they noted at the Workers' Compensation Commission that NADAC doesn't address 30% of the drugs. Now, my problem is, I'm not an expert in this area, but what our amendments do in discussion with many of the members on this committee is allow a fair and open stakeholder discussion at workers' comp or whatever in your legislative wisdom, whatever group should be there. But we also know that through discussions with PDAB, they don't even think they have the full resources to do that. So what we're suggesting is send it back so you don't have wonderful Mr. D'Alessandro butting heads with Mr. Garza and everything there. We understand the pressures on the chair, who's a good personal friend as well. But we're here to make policy. And when you got 30% of the drugs off the table, you're not coming to the solution you want.
And I'm only bringing this up because, again, it wasn't that it was just Madam Chair's bill, that it passed so unanimously through the Senate. Were these amendments tried in the Senate? And I know it's difficult to work with the Senate because we have to work with them all the time here. So, but I just want to know, were these amendments applied and proposed to the Senate? And again, let me stop putting you on the spot, buddy. I was just, because you spoke the loudest, I want to go with you first.
All I want to say is the chair is a wonderful chair of finance, and she's been a wonderful member and a great representative.
You got other bills in her committee then, right?
And bills pass for various reasons. We had discussions with finance members, and there was concern, but I'm going to leave it at that.
Colleen, you look like you had something to add.
I think there's no one in this room that doesn't understand the politics, and I think politics had a lot to do with it.
I'm confused, but I don't understand the politics. The only politics I understand at this point is every now and then we do, I don't defer to the Senate as such, but depending on the sponsor, we pay attention to when a bill comes from a Senate chairperson and was unanimous. And that's why I was trying to figure out, were all these things missed? Wait, I want you to make sure you think about your answer, because we all have futures here. So, but I wanted to know what was if these things were all addressed, that you did your due diligence, and that there was some either miscommunication, or was it just that they were not agreeing with your side?
Yeah, Mr. Chairman, if you don't mind, I can answer that question. Yes, we have actually spoken to the Senator Bidel quite often, and we are very grateful for all the conversations she's had with us. And we do think that we've made a pretty good case in the Senate for having an amendment that would allow the Workers' Comp Commission to look at all the fee schedules. We didn't think, we personally don't believe that our amendment is out of bounds. In fact, we think it's quite fair to allow the Workers' Comp Commission to look at all opportunities, especially those that are done in 35 other states, and that's really all we're asking. The Senate disagreed, but we're hopeful that Economic Matters will at least see that it's a good public policy to allow the Workers' Comp Commission to do its job.
And again, I ask this because I know being, when we have bills and hearings, you always, you get to go first, and then everybody gets to throw on how bad of a bill it is. And so knowing that, I'm trying to find what you guys discussed, the rationale, and I guess I'll dig into that when you guys, when this hearing is over. But I just want to know what they're missing. And believe me, the Senate misses a lot. I get it. But I would like to make sure, and this, not you, Madam Chair, a lot of it. But again, I do have the utmost respect for their decision, and I feel like they've had so much more time than we're going to have to deal with this issue. So I guess what I'll be doing is having to go back, and when I say I mean the royal I, as in my vice chair, and watch some of the video to find out, what it is that's being missing. Obviously, our job is to make good policy. Yes, ma'am.
Excuse me, Mr. Chair, I just want to say that we didn't know that the PBMs and the doctor dispensing was being carved out until literally we walked into the hearing.
Sure.
And that is a major missing link, because it eliminates, you have to understand something, community pharmacies are PBM pharmacies. And they strong-arm them, and they make them sign contracts. And they say, you're not going to get your Medicare patients if you don't sign this. You're not going to get this patient if you don't sign that. And that's why there's pharmacy deserts. And that's why pharmacies are closing. If even here in Annapolis, they're closing. In Baltimore City, I was told by one of the governor's staff that there's none left except for at the hospital. To say that this hasn't affected community pharmacies is outrageous. And we knew that the PBMs would object to this. So they suddenly weren't there. And there was a carve out at the very last second. So we know we didn't have time to bring this amendment or a reasonable solution, because the bill as we see it today didn't exist.
I understand, and I understand that's the unfortunate side of Annapolis. Sometimes you find out the amendments as they're being read across the desk. So I just wanted to make sure that you guys all had a chance to
Mr. Chair, can I just expound on that real quick? I think
normally no, but
okay.
I mean, I usually wait till there's a question to ask unless it's, do you think it's really, really important?
Well, I think it is because you asked the question of what was missing in the Senate hearing.
Yes.
And to answer your question about what I think was missing in the Senate hearing is the testimony that is heard is the pharmacies are inflating prices. The pharmacies are charging everybody too much. The pharmacies are doing this, the pharmacies are doing that. The fact of the matter is the pharmacies aren't doing that. The pharmacies are taking average wholesale price and billing it with what we feel is a fair and equitable markup. What was missing in the hearing within the Senate was the fact that the PBMs are taking our bills and they're repricing those down to what the PBM feels is the right rate to pay within the state of Maryland. And that's what they're doing. So we're hearing a lot, well, the pharmacies are doing this, the pharmacies are doing that, but the pharmacies, even non-network, we are getting cost contained by the PBM anyway because the PBM wants to pay us less so they can make more from the insurance carrier. That piece of it didn't really become clear within the Senate hearings. And I think it's because of just the confusion of how complex the world of pharmacy is, whether it's private health pharmacy, even more on the workers' compensation piece. And when we look at it as a whole, that's the part that was not being contained. It was pharmacies are overcharging, pharmacies are doing this. The fact of the matter is I bill a certain rate, and the insurance carrier who they've hired, their medical bill review and pharmacy bill review companies who they've hired are taking my bill and saying, nope, we're not paying that rate. We're paying what we feel is right for the state of Maryland, and they're paying this rate. And 99% of the insurance companies that I bill in the state of Maryland take my bill, cut it down to a fair and equitable rate, and I take it. The other ones.
And I guess that was the thing that Colleen said that, and I'll again, we'll move on to the next panel, but is your charges versus the payout. And I guess there was I don't know if it's a question of intellectual honesty, but are you saying that you're charging $100 per pill, but you're only getting $10 per pill, so we shouldn't be concerned? Because this is what you're charging, but you're only getting this payout. Sounded like that's what our argument was, but I think it would still be concerning to everybody sitting up here that regardless of the amount of money it's settled upon, that the rates may be so inflated because not everybody always catches that. So I believe there's other questions and we'll probably get back. So Andrew.
Thank you. Actually, my question is for Mr. White. You said in your testimony that what you would like to see, the amendment that you would like to see, is basically for the Workman's Comp Commission to be able to come up with the fee schedule. They'll look at everything. But isn't that what they did? Weren't they the fee schedule committee is part of the Workman's Comp Commission, correct? And they couldn't come up with a decision. And so I know that there were other people, other organizations on that, but they couldn't come up with it. So why do you think that it would be best for the Workman's Comp Commission and not for the Prescription Drug Affordability Board, which I believe is made up of pharmacists and doctors?
First of all, the way it came about, first of all, I have great faith in the Workers' Comp Commission that they could figure this out.
But they haven't done it yet.
Well, for a couple of reasons. One, they already have a fee guide committee that they do for medical right now. So they actually know how to do that. I think the second thing is they actually work on workers' compensation all day long. That's their entire job. And number three is, I don't think they gave themselves nearly enough time to kind of figure this out. We were a member of that process, and I will tell you that I thought it was very, very difficult for them to come up in late September and try to come up with a fee guide recommendation for the legislation session by the beginning of December. I found that an impossible situation for them to do that. If they're given, in this bill, they're given a lot more time to kind of figure that out. And quite frankly, I can't think of a better place to actually do the work that actually in the Workers' Compensation Commission. For us, it makes no sense to have the PDAB do all this. They've already have many, as many of you voted for, as many studies and everything else that's going on there. Plus, as I said in my testimony, workers' compensation and healthcare are completely different. There's a reason why healthcare is down the hall and workers' compensation is here. It's two different things. So let workers' compensation actually do what it's supposed to do.
And you don't think that the PDAB is qualified to do that?
I don't know if they're, I don't know if they're qualified, but I don't think it's the right place to do it.
All right, thank you.
Brief. I have 2 points I want to ask on. One, somebody said 30% of these firefighters, I guess you mentioned the name firefighters, their needs are not addressed initially. They have to wait. Is that a real number? Can anybody else substantiate it?
Presumption cases. 100% of presumption cases are contested at the Workers' Compensation Committee, which means that they have to go through maybe a year or more
Okay,
of
but
hearings.
somebody said 30% have to wait a month or more before they get it. Is that a real number? I don't remember. I think Joe, you might have said it.
Yeah, if 30% of the drugs
Weren't covered, yeah, so they have to go through that. With this bill, they'll have to go through that, you're saying? They'll still have to go through that.
I think what you're alluding to, and I think it was brought up by Gil, is that NADAC itself does not incorporate all drugs. There's a percentage of drugs that aren't found within the NADAC index, all right? So with that, if you are going to create a fee schedule that has a NADAC-based acquisition cost setup, you're going to have to create a multi-tiered, more confusing
The
fee
way
schedule.
I heard it was that if this bill passes, 30% of these people will be out of luck. They'll still have to be out of luck. I didn't hear that then.
In my case, 2,300.
2,300 means nothing to me.
Okay, so, I don't, yes.
I don't know.
What it means is that, you know, we don't advertise, we don't have big marketing campaigns, we don't, you know, we're a small company. My company's down the street, right?
Okay, I'm good with that then. I'm not getting, maybe I'm not conveying it right. The other thing I heard was kickback. I heard that. Can somebody, and is that on both sides? Kickback, that's what it was said. Yes, somebody mentioned the words
They're
kickback.
considered legal rebates?
It's a legal rebate that both ends of this get it. Is that true?
Can you describe what you mean by both ends? I don't know.
The people for this bill, the people against this bill.
The way that rebates work is, it's not disclosed. I think this is really important. There's a lot that's not disclosed. So we don't know what they get.
Okay, okay, but somebody's getting a kickback is what you said.
Correct.
Okay, thank you. Thank you, Mr. Chair.
I believe that concludes the question for this panel. Thank you very much. Move on to the next panel with amendments. We have two individuals. I believe we have Delora Sanchez and Aaliyah Horton. And Delora, you know, I was going to try to do it, but I didn't want to butcher it.
Right.
So tell your husband I'm sorry.
It's quite all right.
If you'd like to introduce yourself for the record and clean that up for me, I'd appreciate it.
No problem. Good afternoon, Mr. Chairman. Well, the Vice Chair was here, members of the committee. My name is Delora Sanchez Ificalche, and I am with Cornerstone Government Affairs, but representing Easy Scripts. Darren Thomas was just here, so I'm working with them on this issue. I am here in support of amendments. And I am going to just go over very quickly what these proposed amendments do. They do three things. First, they require the Workers' Compensation Commission to review all available pharmacy reimbursement models, so not just acquisition costs. You've heard about the 35 jurisdictions or 37 jurisdictions that use a pharmacy fee guide or fee schedule. We are not opposed to a fee schedule. We think a fee schedule is needed. However, we believe that the Workers' Compensation Commission should, before making any changes, and rather than mandating an untested approach, that they go ahead and look at all of the different indexes and then set it from there. Second, the amendments would establish a transparent, stakeholder-driven process. So it will require all affected parties, including pharmacies, insurers, and injured workers and regulators, to participate in reviewing reimbursement benchmarks, so the indexes I was talking about. This ensures that the final policy is balanced practical, and does not disrupt access to care. Third, we address gaps in Senate Bill 306 by ensuring that PBMs are not exempt for oversight. So there was an amendment placed in the Senate that carved the PBMs out. There was a lot of discussion on that. We would like to see that go away and have all folks engaged in this process have that applicable to them. And finally, the amendments remove the prescription drug affordability board's role in this process and instead direct the commission to establish the fee guide with insight from the fee commission or the fee guide work group. So with that, I urge your support of amendments from Easy Scripts. Thank you very much.
Hi, good afternoon. My name is Aaliyah Horton. I am the Executive Director of the Maryland Pharmacists Association. We are not a trade association. We are a professional society of pharmacists, student pharmacists, and pharmacy technicians. I'm here for support with amendment, the amendments that have been mentioned already. We do recognize the need for this bill to provide transparency and consistency in the reimbursement of pharmacy services and medication within this space. I won't talk about the work groups and all that. The bigger piece that I'm concerned about is the pharmacy benefit manager carve-out. During this session, the House has passed two bills, House Bill 321 and House Bill 813, that include studies and work groups looking at PBM practices within the pharmacy benefit space. Delegate Adams knows we've been working with him since 2017 on the issues that have occurred within the community pharmacy space based on those practices of pharmacy benefit managers. And I would love someone to ask me to comment on Mr. D'Alessandro's comments. But I do think the carve out of the PBMs would allow them to have free reign when the House has already passed bills that says we need to look at what they're doing. And these bills, as I mentioned, have the work groups and the reports by the Department of Health as well as the insurance administration. And I do want to say that pharmacies are not, and pharmacists are not vending machines. This profession requires a mix of clinical counseling, drug dispensing, and the administrative function. And this is exponential in the workforce comp space. And in this space, and what we've been working on quite a bit in HGO and finance, is the recognition that, or acknowledgement from the General Assembly, from the state, ensures that this is the only place in the U.S. healthcare system that does not pay providers that work directly with patients. Hospitals get paid, dentists, nurses, everyone else, and we want to make sure that the pharmacy community is supported.
More about D'Alessandro's comments.
Yes, thank you. So he made a comment that Maryland, the state within the Medicaid space, moved to a NADAC and that there's been no impact on pharmacies and community pharmacies. That's not true. Medicaid has moved to what we call a fee-for-service schedule, so to speak. Payment model, thank you. Where within only the behavioral health, they pay the national average drug acquisition cost plus a dispensing fee that's at $10.67, right? The rest within the Medicaid space is within the MCOs and is managed by pharmacy benefit managers. They pay below NADAC, and the dispensing fee in 2021 and 2022 was an average of around 50 cents. That doesn't even cover the cost of the bottle. So I am very fearful with this carve out that's in the bill right now. Whatever the Workers' Comp Commission comes up with, that carve out still allows the PBMs to pay pharmacies whatever they want. Pharmacies are closing. There's been a 2% decrease in 2% decrease in community pharmacies in the state. Pharmacies that are opening in spaces that do not have Medicaid patients. And so I'm just very concerned that there's so much scrutiny in these other spaces that now PBMs are looking for a carve out and their own way to operate again within the workers' comp. And I had to come here and say my 2 cents.
So is that the access to care part?
Yes.
Okay.
Absolutely, and I will say that I would not, I obviously cannot speak on behalf of the independent pharmacies, but I will say that they are fighting for their lives. And if there is concern within this space, within the workers' comp space and the changes that are made, any book of business that they have in this space, they're not going to do it. Because every time they're dispensing medications and providing clinical services, they're putting themselves out of business. The Department of Health has the data, the Insurance Administration has the data as well. And this is just one more thing. And so I really just want to protect them from pharmacy benefit managers.
Yeah, I mean,
and how they the reimbursements.
Yeah, I'm sensitive to that because that's absolutely on the Eastern Shore with independent pharmacies. I know you're not speaking for them in so much, but the point is consumers should choose first and foremost, but more importantly, this bill feels like a price control bill in some respects. And if you're hurting the providers, the pharmacies, then how are you really helping citizens overall? And I think that's probably what I'm hearing you say.
Yeah, and I don't think there's any, as you've heard, there's no pushback on developing a fee schedule because it is transparent and can be consistent. It's just the method in which it's being put together.
You need the fee schedule to work so your pharmacies that are providing access to care can still exist.
So that's consistent, and I think there's a reflection that the state and those that are using these pharmacies also have a consistent billing.
Okay, seeing no further questions for this panel, I'll just make a side note. Commissioner Quinn is here, so after we finish the unfavorables, we're going to call her up. But next we'll go to Chantrice Davis, Kenneth Wisniewski, Steve McCombs, and Scott Baldwin, and you can start when ready. Hey, Jim, is Matt here too, or just you?
Matt's here.
Okay, then I'll just call you guys up together.
Go ahead. Like everybody, welcome one of Grace and Bill's finest, Steve McCombs.
Thank you, sir.
Wow. Constituent.
I actually felt the same. Yes. I appreciate it.
Me? Oh, okay. Do not press. All right. Hello. Excuse me. Hello, my name is Chantrice Davis. I am a surgical technologist in the operating room. I do everything from...
Sorry. Yeah, the microphones are so terrible. You got to speak loudly into them.
I do everything from general surgery to level 1 trauma. I was present last month at the Senate when this bill was originally proposed, and I was denied the opportunity to testify. I'm so happy that you're back because you asked the question, what did they miss? Well, this is about workers' comp, and I feel like everyone's talking about the effect, but no one's speaking about the cause. The cause is, to use her example of eggs, if you have eggs at Giant and Weis that are $10 and Trader Joe's at $12, but if you go to all these stores and you're denied because you're not pre-approved or you're not, or you're pending, the only other option you have to get your eggs would be the guy on the internet. If this is about workers' comps, then we should be talking about why these workers are going to these pharmacies. From the day of February 25th of the Senate, the day of that hearing, I was not approved, pending, or nothing. I was blank. I've been pending, and my case has never been denied. It's been open and approved. I've been pending from February 25th until April the 14th with no cause. I am not able to go anywhere to get my prescriptions filled, and on March the 7th, my prescription was sent into Costco, where it was denied, where Rescue Meds filled my prescription. As we speak today, I had my neurologist and spine specialist send in a prescription to Rescue Meds because I am still pending from now until April 14th. Everyone's doing this thing about it's this amount of money, it's that amount of money. It's about the workers. It's our compensation, and it's medication that we need for treatment to get back to 100% to do the things that we need to do. I am not able to go back and perform surgery or anything else on medication, but I can't heal if I don't have medication. Right now, it breaks my heart that you have people who are due fair treatment, who are due medication just to heal, and they're being denied constantly. Maybe you should ask Chesapeake and everyone else how many of their patients have been denied or not approved, and ask them why are they going to these companies. Because we're not able to get our prescription filled anywhere else. It's not a thing of, oh, I just want to go to the higher guy because they're cool. It's because we can't access them. I'm sorry.
You're good. We got to just wrap it up. Okay. 2 minutes. Okay, good.
I am good.
Okay. Go ahead, sir.
Good afternoon. My name is Scott Baldwin. I'm here to oppose the bill. From what I've heard, I know very little, but from what I've heard today and rumors of the bill, I think that it would hurt the small local pharmacies. I've been an injured worker since 2009. I've dealt with numerous separate pharmacies, including statewide and nationwide pharmacies. Dealing with out-of-state, non-local pharmacies has proven since 2009 to be very difficult for me. I have recently started using rescue meds and knew nothing about them until very recently. I've dealt with them for the past few months now, and it's been life-changing for me. As far as there has been no hiccups in getting my medications, there's been no excuses as to why I can't get my medications when I'm supposed to get my medications. Rescue meds being local, truly local, I now get my medications same day that my doctor prescribes them, which is huge. My other aspect of learning today, I don't understand why, if the commission itself does not want this responsibility, why it's trying to be imposed onto the commission to take this responsibility. That doesn't make sense to me. Maybe I don't understand it enough, but that doesn't make at all sense to me. So again, my testimony here is that I oppose the bill simply because I think that in the long term it would hurt local pharmacies. Thank you.
Go ahead, sir.
Thank you. Good afternoon, everyone. My name is Chief Steve McCombs. A few months shy of being a 40-year life member of the Graceville Volunteer Fire Department in Queen Anne's County. I'm currently serving as the first assistant fire chief and have been a chief officer there for almost 25 years now. At the end of 2025, which is the hardest thing, I'm stepping down. I can't physically do this job anymore. One of the hardest decisions I've ever made. I've dedicated my life to the fire service since the age of 14 as a cadet. During this time, I've broken my back twice. I broke my leg in 6 places, my ribs, hairline fracture of my neck, and numerous other injuries I could go on and on about. I do have high blood pressure. I'm currently employed with the Caroline County Department of Emergency Services, where I serve as a shift lieutenant at the 911 center. I had to get out of the fire service. I just can't do that job anymore. I was also a PG County fireman, Ocean City fireman, and I worked for 3 independent fire departments during my career: Centerville, Denton, and the Kent Rescue Squad in Churchtown. I'm here today in support of companies like Rescue Meds. For the last 14 years plus, I've been through hell with my back injuries, and the quality of life now is horrible. I unfortunately rely on medication just to get out of bed on a daily basis. Without these medications from Rescue Meds that they provide, I tend to wake up depressed, very upset at my current situation. When I use pharmacies like CVS, I sometimes wait longer periods for some of the medications that I need. And I'm talking up to a month or a month and a half at a time. They help me, Rescue Meds does, they help me out a ton when I get my medications within 24 hours of going and seeing my doctors, as well as this gentleman next to me. The reimbursement rates being proposed is unreasonable, and with the use of an acquisition cost index, it will prevent access to critical health care for injured firemen and other public safety personnel. We risk a lot on a daily basis to go through what we do, and it's unfair to us. I'm not alone in this. Many other firemen and police officers are in the same situation. The other point I'd like to include is how important it is to have another option to get my prescription medications, and how without companies like Rescue Meds, things could have gotten worse.
Good, sir. Okay. I want to just echo what Delegate Aaron said and thank you. for your service. It sounds like it was a very lengthy career and dedication to our entire state, and so we're all very appreciative. Seeing no questions for this panel, next we'll go to Jim Lanier and Matt Pavola. You guys can start when ready.
Good afternoon, Mr. Vice Chair and members of the Economic Matters Committee. It's been a long hearing, so we'll be very brief. What I really want to do is, Jim Lanier on behalf of the Maryland Association for Justice. Sorry?
I had my testimony too. What's your name, sir? Mark Chaplin. Come on up, sir.
Thank you, sir. So instead of reiterating everything that's been heard so far, I wanted to kind of focus on Delegate Weibel and Delegate Harrison's questions about the Medical Fee Guide Committee. So it is a standing committee of the Maryland Workers' Compensation Commission. It is required to, at least every 2 years, go back over the fee guides and make adjustments as necessary for pretty much every medical treatment, with the exception of 3 things: prescriptions, dental, and durable medical equipment. Everything else is covered by the medical fee guide. So MAJ is in opposition of the bill as written, but we are in support of a fee guide for prescriptions. I think the best part of the bill, if this committee was to make any recommendations that MAJ would absolutely support, is a deadline. Right now, it's the difference between may and shall. The committee and the Workers' Comp Commission as a whole may set a rate, may set a fee guide. If you make that shall, and using Senator Vital's date of September 1st of 2026, then the commission has to make a decision. The fee guide has to make the recommendations and adopt a fee guide. The MAJ would 100% be in favor of requiring a fee guide for prescriptions to be created. And this very complex debate could be had at the body that has to deal with these issues on a day in, day out basis. So we are in opposition of the bill, but we are 100% in favor of a fee guide for prescriptions. Thank you very much.
Thank you. Matt Pavola, also with the Maryland Association of Justice for many years. I've been representing injured workers for 40 years. Like Mark here to my side, I haven't met him before, but he and the panel you just heard from are the folks that I deal with every day, all day. They are the salt of the earth. It is a pleasure to represent them. MAJ sees the injured worker as its only client as so far as the workers' compensation laws are concerned. Furthermore, we trust the Maryland Workers' Compensation Commission implicitly and explicitly to handle this matter, this index, and coming up with, I don't know all those letters, that's way out of my bailiwick, all the letters we've heard today. I don't even pretend to. That has nothing to do with what I do in the trenches every day. But I do work with the commission, and I trust they will do it the right way. They will address this problem that's been raised. I can tell you that I do fear that some of those pharmacies who testified with their amendment, like Rescue Med and IWP, they have rescued my clients who were denied medicines early on following acute injuries many times, and I would not want to see them threatened. So that would conclude my testimony.
Hello, my name is Mark Chaplin, and I've been in construction for 20 years. I was an electrical foreman. I'm now unemployed and disabled, and I'm also a student at CCBC. And I think that Bill 306 is corrupt, and the fact that even someone wrote it down is justification that there's corruption in our government. It will hurt businesses and hardworking people all around the state. And I think the writer of this bill should be investigated. And I'll tell you why at the end of my story. I had had back surgery because of my work injury in March of 2023, in which Workman's Comp was ordered to pay for all my medical expenses. I had to stay a few extra days because I wasn't able to walk due to pain. My surgeon prescribed me new medications while I was in the hospital. After a few days, I was able to walk again without a lot of pain. He said I could go home the next day. That afternoon, I was ready to go home. The social worker from the hospital came to my room and told me that Workman's Compensation refused to pay for my walker, and I didn't have the money. The hospital had to donate the walker to me just so I could leave. My surgeon walked me down to the lobby to make sure I got my prescriptions because there was a nerve pain medication I had to take. He told me if I didn't take the medication regularly, I could have seizures or possibly die. So I went to the pharmacy, which he put in the day before. The pharmacist told us they were still waiting for prior authorization. We waited 2 hours with the doctor checked in every 15 minutes. And the doctor seen me, I was in so much pain. He went and paid for the prescriptions out of his own pocket so that I could go home. When I got home, I called a social worker from the hospital to schedule a nurse and a physical therapist to come to my home to help clean me because I lived alone. To help clean me because I lived alone when I left the hospital. The social worker told me that Workman's Comp Insurance denied my nurse, denied my physical therapist because the adjuster was on vacation and no one else could approve anything. I called my lawyer immediately. He told me he was trying to contact them and told me about rescue meds. It took over a month for me to get into physical therapy, which I was already walking by myself. Since I started with rescue meds, my prescriptions have been delivered every day. And the same day I see my doctor.
Sir, I'm going to need you to wrap it up.
Please vote no for this bill because it's going to hurt American businesses and Workman insurance companies, Workman insurance companies won't even pay for my prescriptions now. Like, I can't even get them to pay for court-ordered procedures that they were supposed to.
Sir, we appreciate it. No, we appreciate it.
Thank you.
I'm very sorry for the injuries that you sustained and, frankly, what you've had to go through since. So, seeing no further questions for this panel, I'm next going to call up Commissioner Quinn. So, Madam Commissioner, as you kind of walk up, I mean, obviously, we've heard a whole host of testimony today. And I just kind of want to start with, you know, I mean, does this bill, at least from what I understand and what I've heard, give you, the commission, the tools or authority that you need to set a fee schedule? Because I'm reading the letter that was addressed to the chair, and it seems like you have some concerns with the AELR. And I just want to, you know, Chairwoman Beidel brought the bill, and I just want to make sure, is this enough for you to set a fee schedule that ensures access and reasonable costs and give you the tools needed? And I guess I can just start there, and then if other members have questions, they can jump in.
Yes, good afternoon, members. For the record, Maureen Quinn, I'm the chair of the Workers' Compensation Commission, and you should just know that back in 2023, we convened our medical fee guide in the hopes that they could make this choice. But it became abundantly clear that the injured workers advocates all wanted AWP, the insurance companies all wanted NADAC, the doctors didn't know how much prescription cost, they just wanted to make sure that they were still able to prescribe from their offices. So we really did not have any broad consensus to make a public policy choice. Similarly with my commissioners, they are 10, I'm one of the 10. We're very accomplished workers' compensation lawyers. We have no specialized knowledge concerning pharmaceutical markets. So if this bill becomes law, it's a game changer in the sense that there is a PDEB study. Because one of the questions that was on my mind after our effort in 2023 was, who is acting in the public interest? Because the same witnesses that you saw here today were the same witnesses that came before us in 2023. And I don't know about you, but do you feel like enlightened enough by what you heard today to make a decision? Because I didn't. I don't want to take any pharmacies off the market, but I don't know where that number is. And so this bill gives us a PDEB study. These are people who know pharmaceutical markets and they know what's in the public interest. And if I have that information, I trust that my commission can make a good decision.
Can I just, I guess, ask the follow-up there, right? Is like other workers' comp commissions in the country have done something similar, right? And I don't know about other members. I know that we have been lobbied, talked to, et cetera, from a whole host of people. And frankly, some of them have asked us to set the fee schedule ourselves, which if you don't think you know anything, I don't know what they think I know. I mean, that's mind-boggling to me. But it just seems to me that, you know, regardless of however this bill ends up landing, you and your commission are in the best possible position to make an educated decision on where to go for the state. I mean, maybe I'm missing something, you know.
Well, our agency adopted AWP 12 years ago.
Right.
And then we brought it down to here to AELR, and Big Pharma lobbied big, and those regulations never became law. So that's why we still have this old usual and customary rate of reimbursement. So a lot of states have adopted AWP over the last 20 years, but that was before PBMs became so greedy and warped the market. And so I think most entities and institutions right now just are very perplexed about what's going on in pharmaceutical markets, whether it's workers' comp or just the Medicare or in the private sector. So that's why the PDEB study is so important.
Okay, we'll go to Delegate Valderrama.
Thank you, Mr. Chairman. Just a quick question, and welcome.
Thank you.
It sounds like you support it, but do you support the bill as it was introduced or with the amendments that were proposed?
Well, I think that the amendments brought in the PDEB study. They also added the allowance for a percentage increase below or above NADAC, and that gives us a lot more flexibility to find a compromise with all parties.
Okay, so as amended.
As amended, yes.
So, I mean, I'm happy to be on Economic Matters Committee. I will say with some acknowledgement that pharmacies are near and dear to my heart through the lens I'm a business owner, right? So I know what it takes to run a business, hopefully profitably. And what I learned very early in my political career, which started 11 years ago, is that pharmacies were under pressure. So that's how long this has been going on. So in a committee like this, when I hear this sort of focused testimony that has us worried about access to care, that happens to be sort of where I started in politics once I got here. And the question I have for you is that when we talk about access to care and when we talk about fee schedules and all these things, you seem to be saying that you're concerned about the same sort of things, the access to care component. I don't want to get into the politics of PBMs, because I have my opinions that I think relate to what you're saying, but is that your overarching concern? You're worried about warping the market to the point where people can't get what they're after?
Yeah, I think you understand my point, and you've been given a lot of data today, and if you just look at the numbers, just common sense would dictate, well, AWP looks really large and NADAC looks really low. Where's the middle? And an acquisition of a drug isn't the whole cost. You have to store it somewhere in a place where you pay rent. You have to have a pharmacist who puts it in a bottle. You have to have other types of staff, legal compliance staff. So we've got to have someone with expertise tell us, when you add up all those costs, how do we come up with a number that's fair to patients and fair to the pharmacies that serve those patients?
So the other thing, and this is just my closing question, is that I've also heard from some of the independent pharmacies that they actually have to serve customers at a loss. Like they actually have to fill a prescription and lose money in order to be sustainable in the marketplace so they can do business where they can make margins. So it's not linear, this conversation about margins coming or going. It's that this entire business model is under stress, and you just happen to be here on a very important component of it. But I find it interesting that you're sort of articulating the same things that I think we've dealt with for many years in Maryland, that these pharmacies can't just do it for fun, right? That's, yeah.
Thank you. Just one quick question. You mentioned usual and customary, which is what we're doing here currently. And Senator Bida was kind enough to provide us with the definition of some common terms. Would you just explain what usual and customary is for some of us?
Well, there really is very little actual usual and customary. As I mentioned in my letter of information, what typically happens is there's a contract between the insurance company and the pharmacy, and they agree upon a rate of reimbursement, and they sort of call that usual and customary.
Okay.
It's kind of like when we go to the dentist. I mean, dentists still use a usual and customary rate.
Okay, thanks.
Madam Commissioner, I just want to kind of come back. I've been Googling, which is always dangerous. But I think all we're asking you to do, if I'm not mistaken, I have the bill here, or excuse me, all Senator or Chairwoman Bida is asking you to do is, conduct the study and kind of be the judge to make recommendations to the legislature. I mean, it's not asking you, I think, to be the subject matter expert on any one of these specific topics, but that you have reached the ability, the oversight of the commission to get those subject matter experts in front of you, deliberate, and then make the recommendation.
Yes.
And set the fee schedule. So I'm not, I mean, I'll make probably a terrible example, but if the PSC told me, anytime it's an energy.
I know a little bit about the PSC.
Actually, yeah, that was a bad example. I didn't even think about who your terrible example, but I would laugh at your husband if he told me that.
I'll laugh at him with you.
Okay.
Well, we are required to pass regulations, but those regulations have to come before ALR. So they still have to pass legislative.
Okay. And I mean, the PDEB is conducting a study, right? So.
The bill calls for that, yes.
Okay. So, and then based off of that, okay. All right, I got it.
Okay.
Seeing no further questions, tell your husband I said hello.
All right, I will. Thank you for the opportunity.
Yeah, and we will next go back to Chairwoman Bidle, Senate Bill 695. And if you want to.
Thank you, Mr. Vice Chair. This is an easier bill, I swear.
Okay.
But a little bit complicated at first. I'm going to assume everyone here knows what UEF is. Let me start out. Let me redo this. Thank you, Vice Chair Crosby and members of the committee. We've been here a long time. I feel like I'm your friend at this point. But I'm Pam Bidle, District 32, here to represent Senate Bill 695. So UEF is the agency that takes care of people that do not have workman's comp. They should have had workman's comp. Their employers should have been carrying workman's comp, but they were not. And so someone gets injured, they go to the Workman's Comp Commission, who then says, yes, this is a legitimate claim. yes, you don't have workman's comp insurance, you should have been covered, now you're going to go to the UEF and you're going to get workman's comp. So everybody kind of understand that, what UEF is. So what's happened in recent times is the UEF is doesn't have enough reserves. They're in real trouble. They're going to run out of reserves like in 18 months. So you already have had a bill from the governor that increases the assessment that insured companies are paying to another 0.5%. So now they're getting 1.5% of all other workman's comp claims that are paid to try to keep them in business. That's just the background. What this bill does, it would ask that you increase the UEF board from 3 people to 5 people, actually put some parameters in about the experience those 5 members should bring to the board so that they can handle their long-term solvency problem, give them some accountability and oversight, and hopefully help them get back in good standing fiscally so that our companies that are paying the claims, the good companies that are paying the claims, will not have to continue to subsidize UEF to this point of 1.5%. It's really just giving them some additional expertise to help with their board and their decision-making and their contracts, like for the third-party administrator, which seems like it's been a little out of the realm of what really is reasonable. So it's an easy bill, just basically changes the board and then tells them that they do have to, they shall have a certain reserve amount, not that they may, but they shall have a certain reserve amount. So that's Senate Bill 695.
Seeing no questions, thank you so much. And I think, is that it for you, Madam Chairwoman?
That's it for me, Mr.
Okay.
Vice Chair. Thank you very much for
your
indulgence.
2 favorable, Julie Murray and Carmen D'Alessandro.
Thank you, Mr. Vice Chair. Again, for the record, Carmine D'Alessandro, representing Chesapeake Employers and Injured Workers Insurance Fund. These bills, and my written testimony actually references 695 and 219. They have come out of a work group that was established by the legislature to look at the solvency and the operational structure of the UEF. I'd be remiss without thanking Delegate Harrison, who served on that work group for the better part of the past year. And this represents what we feel is a compromise. On the one hand, there is a 0.5% increase to the assessment, so that's money going to the UEF to help their revenue. That comes from businesses. Obviously, the chamber and businesses were not very in favor of this because it's an extra tax on them. But we feel with the board changes of 695, everyone is giving a little here for this compromise. So we are trying to increase their funds so they have more money to care for injured workers, at the same time giving them insurance expertise so we do not keep coming back here on insolvency issues. We have been before the legislature 4 or 5 times in the past 7 years dealing with the UEF's insolvency issues. The legislative analysts just moved that date up to 2027. They've also been instructed to file a report by the end of the year is whether they can terminate their contract with a third-party administrator before the 5 years expires. So there are significant financial issues, hence the 0.5% increase in Senate Bill 219, which I believe you've already passed out. 695 then would give them some insurance experience. So 2 members of the board would have to have experience in property and casualty. 1 would have experience in finance. 1 would be a policyholder with a workers' compensation policy, and the other, I believe, would be at large. So all these bills came out of that work group, and Chesapeake and I, with support both 219 and 695, hopefully they come out as a package to help the future solvency and the infrastructure of the Uninsured Employers Fund. Thank you.
Thank you. Good afternoon again, members of the committee. Julie Murray on behalf of the Maryland Defense Council. I know that you've already heard a lot about workers' compensation, so I will try to keep this relatively brief. The Maryland Defense Council did originally oppose the assessment bill. However, with the makeup of the Uninsured Employers Fund being proposed to be changed in that bill. We believe that together, these bills will work to help address the issues that we're having with the uninsured employers fund, specifically as it relates to the solvency of the fund, but also being careful not to penalize too much who we always call the good actors, which is the employers that have gone out and gotten insurance and are essentially funding those that have not done so via the assessments. We believe that this bill is a strong step forward towards making some systemic changes for the uninsured employers fund that we believe will have hopefully a lasting impact and create a better structure for the fund that can help it function in a more viable manner. So thank you very much.
I just have a clarification. I noticed in the bill that labor had a representative, and now we're flopping it out. Can you define labor? Was that employers? It said I shall represent labor. Now it says two shall have experience as officers, employers of a property and casualty insurance. So is labor no longer represented, or?
Under the bill, no. The original statute that dates back 35 years or so, there was a 3-member board. Management, labor, public at large.
Okay.
And we thought there was no insurance acumen with labor, those 3. So we replaced all 3 with more insurance-minded people.
Okay, so there is no labor currently in the way the bill's written.
Correct. And you know, there's been some talk about this would hurt union workers. Union workers work for employers that have insurance, so there really isn't that angle at the UEF. So
okay, thank you for the clarification.
You're welcome.
Seeing no further questions, we'll go to the unfavorables. Michael Burns. You can start when ready, sir.
Thank you. Mr. Vice Chairman, honored members of the committee, my name is Michael Burns. I am the director of the Maryland Uninsured Employers Fund. I can read you the first sentence that we always use as our mission statement. The Uninsured Employers Fund exists to protect Maryland workers whose employers fail to obtain workers' compensation insurance. That is what we do. That is what we do. We do not represent industry. We do not represent the insurance industry. We represent those people whose employers have broken the law and left them without any recourse. We are their lifeline of support. We have had a board since 1983 that consists of 3 members, labor and management and the general public. I have brought our chairman today, Mr. Martin Lewis, who sits behind me. Mr. Lewis has decades of experience in the insurance industry. He was a broker and seller of insurance. He was one of the top 50 insurance agents in the country for State Farm. He has been our board chairman for 8.5 years, giving us the benefit of insurance background and experience. Our public member is an attorney, Casey Bryant, who has been on the board for 5 years now, I believe, who brings a legal background, a legal experience, and of course, obviously, workers' compensation experience as well. Most importantly to me, we have a labor member, and that labor member delegate has one job, and that is to look out for the interests of these uninsured workers. That's their job on the board. They are there, and they've been there for 42 years in order to make sure that the top priority of this agency is the uninsured worker. That will change under this bill. This is a bill that was brought by the insurance industry to you. This is a bill that benefits the insurance industry. It is no surprise they are here telling you what a great bill it is, because for them it is, because 80 to 90% of our assessment is paid by the insurance industry. And who better to decide on how much that assessment should be for that industry than that industry? Ladies and gentlemen, the Uninsured Employers Fund is not an insurance company. We are a payer of last resort. Although it is of some benefit to have insurance experts, it is not needed and in fact is counterproductive in some ways. Changing the board membership will take labor out of the mix. It will take the representation for our injured workers out of the mix. And I must tell you that this matter was not discussed by or voted on by the work group. at all. Thank you for your time.
Thank you, Mr. Director. Seeing no questions, that concludes this panel. I just want to say, I know I've gotten a few text messages about it, about comments made about senators, and while my chair probably wants to investigate every senator, that is not the case. And so, everybody brings their bills, with noble intentions, and are trying to bring them forward. And so we just want to thank everybody for their participation. And, I don't think those comments made by that particular individual, while may have seemed insensitive, I don't think they were coming from the right spot. So we'll just let them go. Okay, next we'll go to Senator Washington, Senate Bill 984.
Thank you, Mr. Chairman. Do you mind if I bring up a person on our panel, please?
Yep, you're good.
Am I coming up from MIA? If they're still here, by the way.
They left you.
Thank you, Mr. Chairman, members of the committee. Senator Alonzo Washington here to present on a very important bill, Senate Bill 984, private passenger motor vehicle insurance use of programs that measure the operation of an insured vehicle. A few years ago, this committee, along with the General Assembly, passed legislation authorizing auto insurance companies to be able to track the usage of your car. It was for a few reasons. One was to slow people down because we want to see if you're tracking them, then you know how fast they're driving. Two, to make our roads safer. That was another reason why. Three is to decrease accidents here in the state of Maryland. So we authorize these insurance companies to use something in the industry that's called telemetrics. We have, see, they didn't leave me. What are you talking about? Still here? I apologize. That's okay. Thanks for being here. And so we authorized them to be able to use these telemetrics. And since then, it has morphed into not only tracking the speed, but also tracking your usage of your car, how late you use your car, how often you stomp on the brake, where do you go at night, how far you drive, how long you drive, the distance that you drive. They measure everything. Now, this isn't an option for anyone to use. There's about 68% of folks that live in the country that have decided not to use this telemetrics. So that's sending an indication that it's not useful. And also one of the points that they bring up is that it was to drive down the cost of car insurance. So now we all know that car insurance has not decreased at all over the years. It has increased significantly. We know that they're tracking us even more significantly now than before and ever. And we know that it's become a severe issue here where insurance companies are making an exorbitant amount of profit on auto insurance this year. So this bill that I brought before you, which has many amendments that I work with MIA on, it requires disclosure of the usage of these tracking devices. So anytime that someone signs up in their auto insurance, they have to know, disclose that they're actually using these devices. They cannot require participation in a program that measures the operation of an insured vehicle as a condition for underwriting a private passenger motor vehicle insurance. So what that means is right now we have allowed some insurance companies to be able to say you cannot use our insurance at all if you don't allow us to track the use of your vehicle. Number three, it says you cannot use, part of the bill says you cannot use data collected through a program that measures the operation of an insured vehicle to cancel, refuse to renew, or refuse to underwrite a private passenger automobile insurance policy. I mean, this is based on that if you use telemetrics, what we're saying is that you cannot refuse to underwrite them or refuse to renew their insurance based on the usage and the data that's collected from that system. It also allows an appeal process by which the policyholder can correct or appeal data believed to be erroneous. Right now, if you wanted to appeal that and say that this was wrong, the way they're measuring the operation of my vehicle is incorrect, they cannot, as an insured, you cannot right now appeal what they've decided on at all. So this bill allows for an appeal process. It also prohibits the rate increase on a monthly basis based on a date in which the policy goes into effect, more specifically, no less than 6 months. So what part of this bill is saying is that if you enter into a 6-month agreement with the car insurance company, which we all do, but also you say that I want to use the system that you measure my car and my operation of my vehicle, you cannot increase my rate month by month, or as the current law states, every 45 days because of the usage. It is known that every 45 days, a person's car that uses telemetrics, their car insurance either increases or decreases within that 6-month period. This bill will stop that and say that they can use that data and that information to increase or change their insurance rate after the 6-month period. And lastly, I know, because you're going to read the rest of the amendments here, it allows the administration to adopt regulations to limit the types and amount of data that may be collected. We believe that the administration will be able to handle implementing this service and implementing what it should look like and types of data that should be collected using this. This bill does not say that they cannot use telemetrics or the tracking of your car. It says we should put some parameters around it, make it more consumer friendly, and make sure that the data that they do collect is protected. And so the proponents here is what I would like for you all to do is, as the proponents come up here, I would like for you to ask them, one, if this is really working so well, how many of the folks that use it have their insurance actually declined? How much are these folks actually saving the motorists that are here in Maryland? How much money does it save each motorist every year? And how does it actually work? In the committee hearing, I asked them specifically, how does it work? Show me the process and how this works and how it should work on your end. And they were unable to answer that question for me and how it works. I would ask that you ask them that. For these reasons, Mr. Chairman, I respectfully request a favorable report on Senate Bill 984.
Thank you so much, Mr. Vice Chair and members of the committee. I appreciate the opportunity to share our support for this bill. Senator Washington explained the bill beautifully, so I'll just add a few additional nuggets here. You've heard us say time and time again that MIA is first and foremost a consumer protection agency. That is what we prioritize, and that is why we're happy to support this bill. This bill addresses the increasingly prevalent use of telematics systems in the private passenger auto space. These systems offer potential benefits, but they also raise important questions regarding consumer protection and transparency. Senate Bill 984 takes steps towards ensuring that Maryland consumers are protected when their driving data is being collected and used by insurers. First, it's mandating that insurers clearly disclose to insureds what specific data about their driving habits and vehicles is being collected through telematics systems. This right to know will empower consumers to understand how their insurance rates may be influenced by this data. Second, the bill also requires insurers to establish a clear and accessible process by which insureds can contest the accuracy of the data collected. This is supported in the complaints data that MIA gets. We get complaints from Maryland consumers, and our data supports the need for a more robust appeals system in place. As the sponsor mentioned, it also directs us to adopt regulations limiting the types and the amount of data that PPA insurers can collect through telematics. This is recognizing the need for regulatory oversight to ensure that data collection is fair and relevant. Our agency has already taken proactive steps to understand the landscape of telematics in Maryland. You see from our written testimony that we have issued a survey to the top 18 PPA insurers, and we will be releasing those findings in the coming weeks. We hope that will be a helpful data point as well. While we don't take a position on the provisions regarding mandatory telematics programs, we do strongly support the enhanced transparency and consumer recourse measures contained within the bill. You'll also note in my testimony that we're suggesting some minor amendments to clarify that the bill applies specifically to PPA carriers and to adjust the effective date to January 1. Thank you for the opportunity to share our support.
Yeah, real quick, Senator Washington, just, I mean, I've heard of, I guess a couple of my buddies, and they drive a very specific car and they use that car's, I'm assuming by that giggle, you probably drive that same car and use that same insurance?
I don't know what you're talking about, sir.
Okay. Okay. All right, so I won't go there. But it seems like that's what you're describing in terms of their insurance policy. But I guess, can't you just use an insurer or switch to a carrier that doesn't use telematics?
No,
not everybody does.
Well, I think your premise is a little off. So every almost all car insurance companies in the country offer this telematic system.
For sure.
All of them offer it. There are some companies that require that you use it in order to use their insurance. This bill isn't simply just about the ones that require you to use it. It's also about the ones that have it as an option. If it is an option, there needs to be some disclosure requirements. There needs to be protection of data. There's nothing in the law, there's nothing in the law that says that one car insurance company cannot sell the person's data to another car insurance data to be able to develop what their risk would be if they leave. So this bill will ensure that there are some data protections there too. So it's more than just that one example that you have.
Okay, so going back to the data privacy bill from last year, they could, I don't know how that, okay. I don't really know how that would jive, but I get what you're saying on the underwriting portion. Yep. Delegate Weibel.
Yeah, I think my questions were answered there. So currently, an insured has the ability to refuse participation in such a program, right, and still maintain insurance or still be insured? Or can companies require them to participate in these programs to be insured?
Yeah, under current law, there are some insurance companies that have the ability to require it if you want to have their insurance.
And that's allowed under law?
That's allowed under law right now.
And then your bill does address the sharing of data and it allows that, or just ensures that it's part of it?
Right now, the MIA, and they can speak to this, they're conducting an assessment of the programs throughout the state and throughout the country and coming up with regulations and potential regulations on data privacy.
Okay, thank you.
Is that right?
Thank you, Chair. Okay, so currently cars have the ability to record data, and I just want to make sure we're straight on this. If you get in an automobile accident, I mean, it's for tracking your speed, probably, whether you're on your accelerator, on brake. I assume post-collision, there's some of those technologies. And what consumer protection is it you're actually after? Because I'm not familiar with any insurance product that requires me to give that data on a regular basis to the insurance company. I mean, I could see post-collision.
Well, thanks for the question, Delegate.
Yeah.
Currently, car insurance companies can offer a system which is called which in the industry is called telematics, which can discern how you use your car, how you operate your car.
So you're telling me
and what it does is before you get in that car accident, it can tell you how you're using your car, and they can change your rate. We have allowed these companies to be able to change your rate, whether they're decreasing it or increasing it. I would argue that they're increasing it more times than none, based on how late you drive, based on how you step on the brake, how late you drive your car, how long you drive your car, the distance in which you drive your car, and that's before you get in an auto collision. That's different from what you're saying. When you get in a collision, that's totally different. This is before. I'm talking about before you get in the collision.
The only reason why I bring it up is just the follow-up to the question, which is consumers normally get this because they want to save money. I mean,
Correct.
So is your testimony that they're being told, here, give us the data so we can save you money, but it's actually being used?
Correct. It's supposed to be an incentive, and MIA just mentioned that too. It's supposed to be an incentive for you to be able to track your car to make sure that you are being a good driver, what they call a good driver discount. I know we've all heard it many times. And you get this good driver discount, but then once you make the wrong turn or you're driving too far late, you're driving too late coming from Annapolis and going somewhere, going home, they tell you you're driving too late, and then they will ding you on it and say, well, we're going to increase your auto insurance because you're driving way too late, and it increases our risk of what we would rate you.
I think I understand. I'll listen to the other side, but I understand your bill now.
Yeah, thank you.
Thank you. A couple of questions, I guess, and I don't know if Delegate Weibel started to ask it, but do you know currently, as far as the data privacy is concerned, are all the car companies actually holding this data, whether you are insured with them or not? I'm sorry.
Yeah.
Do you understand what I'm saying? In other words, whether you are insured with the major car company that we're talking about, one of the major car companies.
Fair enough, yes, okay.
Are they holding all that data, whether you are participating in their insurance or not?
That's a good question. I don't know the answer to that. I don't know the answer to that. If it's a major car company that tracks your car, where you go and how often you use it, I don't know the answer to how, if they still use that data or house that data within themselves. I will guess that they probably do, and we have an understanding how they use it, but I don't know clearly know the answer to that.
Do you know?
I fear I don't. It's not something that we know,
Right.
and I feel like if I'm picking up on exactly what you're asking, I feel like this is a question that I have asked myself, and I can certainly go back to our principal counsel and see if there's any additional light we can shed on it, but I don't think that we know that.
Okay. I mean, and the reason I ask is because different car companies have different levels of ability to track their telematics. Some of them are much more advanced than others. So to Delegate Adams' questions, pre or post car accident, what information is gathered? Okay, my next question.
I just want to make sure that I'm framing the question appropriately. So you're asking if, for example, if you have a car that has a built-in telematics system, but you don't have the telematics turned on because, say, you're insured with a different carrier, and therefore you don't have to have the telematics turned on, you're asking what do they do with that data, and do they still collect it and hold it even if you haven't enrolled in that particular coverage? Is that correct? Okay.
Brilliant. That is exactly what I'm asking.
Yeah, that's exactly a question I've wondered
You just
myself.
asked it in a much better way than I did. So
No, I just want to make sure I'm picking up what you're laying down.
I wish you would ask the question. No, I'm joking.
The next question I have is, do you know what other states are doing on this subject matter?
Yes. So, there are many states, with at least 26 states and the District of Columbia, who are providing legal protections against unauthorized location tracking, which gets to your other question, your question that you just asked us. And 9 states, including Delaware and Illinois, prohibit installing location tracking devices on vehicles without owner's consent, is what I have so far.
Okay, so from the MIA's perspective, is this a little bit territory, kind of like a little bit the wild, wild west until we kind of figure this out? Is that what we're looking at?
I don't know that I would say it's in the wild, wild west, but I also, I hear you that it's not there's no model for it. If I think that's what you're getting at, is there a model that's been used across the country?
Right.
I don't think there is. I wouldn't say that it's the wild, wild west, but there is not a vetted model that's been utilized across the country.
There's no standard yet.
Correct.
Which is what we're trying to work through with this bill.
Correct.
And across the country. Okay, and then my last one is for the senator in particular. I got one, and I got a couple. So if you'd like a sticker, I could give it to you.
Okay.
But the way I understand this is optional. You choose this, I choose it. Isn't this more about a disclosure maybe that they're not telling you? Because I know when I've heard about this, I'm not getting one, I don't want one, but I know when I've heard about it, it's billed as if you're a safe driver, this will help you to it. Maybe the criteria is not laid out well enough to the user to sit back and say, when you do have that jam on brake, that's a mark. When you do have this, because this is billed as a money saver. I don't know who that's for. Again,
it's supposed to be billed as a money saver.
And you're saying that because I'm not aware of it, is it me or is it them that's causing the problem?
So, well, first to take on, it is a disclosure issue. It is optional. In some cases, there are some, as I stated earlier, there are some car insurance companies that require you to it requires you to use their telematics to track your car in order to do that, in order to have their car insurance. And then once they start tracking your information, they then provide you with, then they start to increase your premium every month. And every month it goes up, and then you got to find a way to decrease it so that you drive in a better way or whatever have you. But it is optional for some car insurance companies, but for others it's mandatory in order to use it.
Okay. Is your fear that they're all going to make it mandatory maybe? And then where do we go?
I mean, I think this bill right here in front of you, Delegate, is more along the lines of making sure that we don't require it. It shouldn't be a requirement that you track my car in order to have car insurance. We mandate that every car insurance, someone who owns a car has to have car insurance. And it shouldn't be mandated that the car insurance company has to track my car everywhere I go and what I do with that car and be able to use that data almost however they see fit without my knowledge and consent. And so we're asking for disclosures. We're asking to make sure that it's fair. We're asking to help to do what this telematics system is supposed to do, which is change the behaviors of the driving habits of motorists here in Maryland, and hopefully their premium will decrease in that case too.
Go ahead. Yeah, I'd like to hear it.
I appreciate the indulgence, thank you. One thing I do just want to add is one of my favorite provisions in this bill deals with the requiring of an appeals process. So to your point, telematics are often marketed as a way for consumers to save money on their premiums by demonstrating good driving habits. However, we've seen a lack in sufficient appeals processes. So for example, say you're driving and you hand your phone to your child in the back seat to play a game to distract them. You could be dinged on a telematics program for distracted driving. And currently, as far as we're aware, there aren't appeals processes currently in an app that allow you to say, that wasn't me on my phone, that was my child on my phone, for example. There are some apps that allow you to say, I was a passenger, I wasn't driving on this particular ride, and that's kind of the extent of it. And
well,
so
that's what I'm coming with. I want to know, because you know what, you signed up for this, and now we want to change it. And that's where I'm coming from, that's all. But I appreciate your responses, thank you.
Yeah, thank you. I appreciate the indulgence.
I think it's something different that she said too that we should probably make clear. There are some cars that don't have it built into their car, and so some car insurance require you to download their app in order to use the phone to be able to track where you go with your car too.
But you have to ask for it or accept it.
Correct. Yeah, it is optional.
I appreciate what you're doing, because I know a lot of people don't want this, but when you first see it, you sit back and say, I can save a couple $100 a year.
Correct.
And I get into it, and then I realize I'm a pretty bad driver. Well, I don't realize that. The people around me. The people around me realize that. Thank you.
Your rates are going up next month.
Right?
All right. I think that ends the favorables. I got the unfavorables. All right, we'll bring up, thank you, Senator Washington.
Thank you.
The unfavorables, Nancy Egan, Gina Fortuno, I apologize, Marta Harding, and Robert Enton. Bob, I called you during the favorables, and you skipped. Were you going to melt if you went favorable? What's up, man?
If you'd like me to give my favorable testimony on the finance chair's bill, I can give it to you publicly right now, or I'll be happy to come to your office and share it with you.
Come on by, Bob. All right, go ahead and start when ready.
Who wants to go first?
Sure. Afternoon, everybody. My name is Gina Rotuno, and I'm the Regional Vice President for the Mid-Atlantic region, representing the National Association of Mutual Insurance Companies. Acronym is NAMIC. We are the largest property and casualty insurance trade association in the U.S. with more than 1,300 member companies, and we support regional and local mutual insurance companies as well as some of the largest national insurers. We are a firm believer in transparency and fairness for all policyholders. We are concerned that this bill may stifle future innovation in the telematics space. The telematics programs that NAMIC member companies offer are optional for policyholders to participate or not participate in. When a policyholder is provided with the opportunity to engage in a program, they are informed of the insurer's use or potential use of the data. One of our biggest concerns with the bill as it came from the Senate is the inclusion of language regarding data collection and testing. We believe this provision is overly broad and vague and may lead to some confusion. Dr. Kit Delgado, who's an emergency physician who's done extensive research on telematics at the University of Pennsylvania, has shown that telematics programs that provide frequent feedback and structured incentives can significantly reduce high-risk behaviors while driving. NAMIC has gone ahead and attached a letter from Dr. Delgado in our written testimony as well. SB 984's restrictions on telematics data, determine premiums, or take actions on policies undermine the effectiveness of these systems, which help promote safe driving as well as a more accurate premium prices. For these reasons, we oppose Senate Bill 984 in its current form. We've had some really good conversations with the Commissioner regarding addressing these issues, and we look forward to continuing to work with her and the MIA. Thank you.
Thank you, Mr. Chairman. Marta Harding here on behalf of State Farm, also in respectful opposition of the bill. State Farm has a telematics program that's known as Drive Safe and Save. It is a completely voluntary program. If you don't want to be in the program, you don't have to be. There's no consequence of that. The people that choose to be in it have the option, have the ability then to save, to get a discount on their insurance up to 10% based on other factors, including how much they drive, et cetera. So they have the opportunity to save money. If they get out of the program, they just go back to where they started. It's not, you don't get a penalty because you're not in it. Again, it is completely voluntary. For those who choose to participate, it's an opportunity to save money. And for those that are interested in this kind of thing, it's an opportunity to learn, kind of what their driving behavior is like and to potentially take corrective action. So not everybody wants that, but for those that do, it's an opportunity to learn those things. Again, it's voluntary. This is all under the existing regulatory oversight of the MIA. We have to file our rating plans with them to review. We have to provide, we provide information about the program. And I think I neglected to say earlier, when somebody opts into this program, it is with full disclosure of the factors and the things that are tracked by the app. And once they install it, so they know what's being tracked. It's full disclosure, and of course that is all disclosed to the MIA. There's also a robust complaint process at the MIA for any issues that arise. We are very concerned about the uncertainties in the bill in terms of the additional regulatory burdens that it could place and may overly burden the ability to use these programs, which we think are to the benefit of our policyholders who opt to use it. So, and lastly, I would just say the MIA is about to release, they've gathered information, they're about to release a study, and I believe Ms. Sexton said in the next few weeks, so it feels like this bill is premature for those reasons as well. So thank you, Mr. Chairman.
Sorry. Good afternoon. My name is Nancy Egan. I represent the American Property Casualty Insurance Association, and our members write 64% of the personal auto insurance market. I have submitted written testimony that breaks down the bill piece by piece, but I did want to address just several things that have been discussed. We have carriers that offer just telematics and nothing else. And if you look at the current language of the bill, they are required to disclose to anyone that signs up for them that this is the only option that they offer. If you don't want to be in a company that only offers telematics, then you need to go to a different carrier. The way this bill is drafted, it would eliminate the ability of companies to only write telematics. They've removed that language from the bill. They are required, as I said, to disclose it. In addition, the bill says that they cannot refuse to underwrite or renew a policy based on that data. That means that if a company finds that a driver in the household is extremely a hazardous driver, they could never get off the risk because they would not let you do this under the bill as currently drafted. We have had discussions with the Maryland Insurance Administration. I wasn't quite sure if they were neutral on the language about the telematics-only companies. But in addition, the appeals process really hasn't been laid out how that works. Our carriers do offer an app that is downloaded that works with you, that can give you real-time feedback, and you can make changes to that. But not every company operates the same way. Some companies are only tracking mileage, and that's it. And opposition, I'll turn this over to Bob.
Thank you, Mr. Vice Chairman, members of the committee, Robert Enton on behalf of the American Property Casualty Insurers Association. Our members write about 60% of the auto insurance in the state of Maryland. We're the biggest national trade association as far as policies. We have over 100 auto insurance companies that offer policies in the state of Maryland. We have a total of 3 that only offer telematics. No one, when we heard about require this, require that, no one's required to buy insurance from any one of these companies. They've got over 100 companies that they can choose from. If you don't want to have your premium based on how you drive, then get it from one of the other 97 companies that are out there. Nobody makes you, requires that you have a policy. But what happens is these policies, their standard is based on how you drive. And if you drive good, you're going to save money. If you drive bad, it's probably your premium's going to go up. And they do it from month to month. So you're not locked in for a set period of time. It goes from month to month. And if you don't like it, if you got hit with an increase, nothing stops you from going out and getting a policy with a company that doesn't rate you. It doesn't set your premiums based on telematics. You know, we've got a tremendously competitive insurance market in the state of Maryland. And this is strictly optional. If you don't like it, if your premium went up because the telematics showed that you were doing things that they can justify an increase in premium, and you don't like it, switch to another company. You're not locked in to stay with them. So, there are some things in this bill, and I appreciate the fact that the MIA is involved. They're going to study this. But this bill has a lot of problems. At this late in this session, we would urge you to give it an unfavorable report. Thank you.
Delegate DFH.
Thank you. So a couple of questions for the carriers in Maryland that just do telematics. How often is that rate reevaluated? Is that done on a monthly basis, or is that done on a 6-month basis? So let me just ask that first question.
I don't know the exact process for every single carrier. One carrier was offering it on a month-to-month basis. So they gave you, let me go back. There's one company that evaluates your driving and offers you the rate, and then you can agree to go with that rate or not, and then you're locked in for 6 months. Another carrier that only offers telematics also has a feature where your rate would be determined month to month with a 30-day notice. The MIA has looked at that company to make sure that proper notice is given to the insured ahead of time to know what that rate would be. And they do provide real-time feedback on a daily basis, evaluating your driving, so you're understanding, yes, I braked hard, I was following too closely to that car, I was speeding, I took a corner really quickly and didn't properly stop. Those things are tracked. So it's different ways, but one company is doing month to month, another company was not, and the third, I don't know all the details, so I apologize.
Okay, so my follow-up question is, specifically from a hardware perspective, can you explain to me, not all cars have all the telematics built in, which sends it to the cloud. So I'm guessing there's a piece of hardware that goes in the car or you use a phone app.
It's mostly a phone app. It's a downloaded phone app.
So how is a phone app to determine why you did not brake? How is a phone app to determine whether you were close to the car in front of you or not?
Well, it have to be, and I can't explain for each company, because some of them have, for example, they're looking at how many miles you drive. If you're driving, excuse me, I would have to find that out for you. I'm sorry.
That's okay. It's a pretty technical
that's a good question. I need to get some more details for you on those apps and how they do that. I know that distracted driving is one of them. That's part of the feature.
Yeah,
but I can find some more details.
I would be curious to see how they actually measure those. I think some companies that have a lot of that built into their OS probably have that data, but some of them, like from a phone, I don't know that you can capture all that. And then the last question that I have is, are overall the companies that you represent, are they seeing a higher cancellation rate? Are they seeing increased insurers? Or are they seeing decreased? Or are people coming and leaving? What are they seeing in the industry?
With the use of telematics?
Yes.
I'd have to find that information out and survey them. I don't have that handy. I apologize.
Yeah, I'd like to know what the average length of stay of a consumer is. Thank you.
Delegate Harris.
Just follow up with that. I'd be interested to know how many people actually lowered their rate with this, but you probably don't know that, do you?
No, I don't have that information, and I know that the MIA is doing a survey asking some of these questions.
Did you know? Just if I could, Delegate Aaronson, I think that's one of the problems with the bill. You have unanswered questions that have been raised today, and The MIA is in the process right now of gathering information. I think these are all good questions and something that ought to be discussed. I just don't think that there's been enough information to block this product.
I would tend to agree with you, but I really think this is the way we're going. This is going to grow quicker than we know. And today it may not be a problem, but I mean, my wife has a ring that tells her what her AFib's doing. I mean, it tells her things about her I never knew. And I think that's amazing because I live with her. Anyway, I appreciate you.
Delegate Aarons, with State Farm, if you sign up for the program and you install it in your car, the dongle, I think is what it's called, and you have your phone app, you get a discount up to 10%. I mean, initially, and depending on how it goes, that discount may change over time, but ultimately you're ending up at if you get out of the program completely, or you're the worst driver in the world, you're only going to get to where you were.
I'm looking at the other side of this is buyer. It almost sounds sometimes like, I don't want to use the words buyer beware, but I did. And I sit back and say that if I'm not reading what I'm buying, shame on me, and that we tend to err on that side. But I do appreciate your answers. Thanks.
Thank you, Mr. Chair. I guess I'm trying to understand the rules of the game, essentially, right? So if you're going to have this system on your car or via the app to better understand your driving habits, like what's the standard on what is considered a risky driver? We heard from the bill sponsor that, the time of day you might drive or the length of how far you drive. I mean, I hate to bring this up on the day that that we had a year away from when we had a horrible incident, but there's a lot of drivers now who had a shorter route to home and work, and now that route has expanded. Not because they're a bad driver, not because it's because a bridge fell, right? So is that something that's calibrated into these systems? Like how many external factors are part of how you arrive at the conclusions of whether or not this person is a safer driver or not? And shouldn't we be figuring out a way to make sure it's flat? Because I feel like that is kind of what I'm hearing. There's this company does this company does that, this company does this. I'm trying to understand what is the measuring stick for what is considered the safe driving of how you determine if they're a safe driver to get a discount?
I would have to look at all the various factors, but I just wanted to let you know.
Are there common factors? We got to have some common
mileage driven has been a data point that's been collected by insurance companies since I began as an agent back in 1981. So the more you drive, the more exposure you are on the road to have an accident. So the person that works from their home and doesn't drive and doesn't go anywhere, they're less likely to be in accidents versus somebody that's driving 50,000 miles a year because maybe they're in sales and they're always out on the road selling. So that mileage driven has been a rate factor that's been collected by insurance companies for years. So they've looked at it and they know that the more frequently and more time you're spending on the road, the more likelihood you're exposed to being involved in accidents or things. The other factors, they vary by carrier. We'd have to go through and find out how each one calibrates their rating factors. Some of them are very sophisticated. Some of them, as we heard, are just mileage driven.
Got it. I'll leave this for a conversation offline.
Thank you. And if you have any more questions,
All right, that concludes this bill hearing. Thank you all so much. Sorry, I'm trying to see the senators. I have Senator Hayes. Okay, come on up. Next we'll do Senate Bill 830. I apologize. Yeah, you're good. Do you want to bring up, here, I'll call some people so you don't have to sit up there by yourself, bud.
Thank you.
Carmen D'Alessandro, Michael Daly, Scott Curtis, Maureen Quinn. And that should be 5 chairs, I think. Go ahead. You okay, buddy?
Yeah.
All right, go ahead.
All right, good afternoon, Vice Chair and members of the Economic Matters Committee. For the record, I'm Anthony Joseph here on behalf of Senator Antonio Hayes. I'm here to express my strong support for Senate Bill 830. This legislation modernizes the workers' compensation claims process by improving access to claim records through the CompHub system, eliminating unnecessary administrative burdens, and ensuring a more efficient and fair process for claimants, employers, insurers, and state agencies. SB 830 has 5 key provisions. First, it expands access to essential information by allowing claimants to authorize the release of their claim-related information to their attorney, employer, insurer, and key state agencies such as the Uninsured Employers Fund and the Subsequent Injury Fund. It also ensures all relevant stakeholders have necessary information to effectively process claims. Next, it clarifies the scope of released information by defining the types of records that can be accessed, including medical and financial records, patient charts, examination notes, and prior claims history. It also enhances transparency while ensuring appropriate privacy safeguards remain in place. Next, it establishes a defined authorization period by ensuring that the claimant's authorization for the record access remains valid for a year from the date of filing and reduces confusion and ensures continuity in the claims process. It then promotes administrative efficiency by eliminating the need for excessive subpoenas and unnecessary document searches, and streamlined case management, reducing workload and costs for all involved parties. Finally, it ensures consistency with LE 9-710B and LE 9-711A. 11E 9-710B covers claims related to death from accidental and personal injury requiring dependents to file a claim within 18 months and include and authorized for medical record release valid for 1 year. LE 9-711A governs claims for disablement and death due to occupational disease requiring filing within 2 years, also with a 1-year authorization for record release. SB 830 ensures these sections remain consistent, reducing confusion in the workers' compensation process. Senate Bill 830 is a necessary step towards modernizing Maryland's workers' compensation system, reducing delays, and ensuring fair and efficient access to claims records. We have individuals from the Maryland's Workers' Compensation Commission to answer any questions, and I urge a favorable report on SB 830. Thank you.
Good afternoon, members of the committee. For the record, Maureen Quinn, Chair of the Workers' Compensation Commission. With that explanation, I will tell you that this is going to be the easiest bill that you're going to hear all afternoon. I'm going to give credit to my Assistant Attorney General, who is to my left, who crafted this solution with an all-stakeholder sign-off. So this would have been a departmental bill, but his spark of enlightenment came in mid-December. So we're going to buy him an enlightenment calendar for his birthday this year so we can get our timing right. But in this case, we quickly assembled all the stakeholders in early January and got their consent on this bill. And I want to thank Senator Hayes for stepping up and sponsoring the bill for us, because we got it to him, I think, on the filing deadline or the day before, because we had heard that he only had 2 bills at the start of session. So we took pity on him and we helped him with that. So with that, I'll turn this over to our Assistant AG.
Good afternoon. My name is Scott Curtis. I'm with the AG's office, and I represent the Workers' Compensation Commission. And as Chairwoman Quinn said, I did get a spark of inspiration in mid-December, way too late to have a departmental bill. But this bill does streamline things. As part of filing a claim for an injury received in the workplace, a worker has to file an authorization releasing their medical records. And we wanted to clarify that those records include the records that the commission holds, and that they can get access to those records through the commission's CompHub process. That it also includes 2 other state agencies who can receive those records explicitly, which is UEF, you've heard about them today, and also the Subsequent Injury Fund, which is another state agency that is party to these claims. And so it's about efficiency, and I couldn't have said it better myself. So.
Good afternoon, Mr. Vice Chair. For the record, once again, Carmine D'Alessandro, Chief Legal Officer for Chesapeake and IWIF. I will adopt all the testimony and simply say me too.
Thank you, Mr. Vice Chair, members of the committee. Michael Daly from the Maryland Defense Council. Happy to do the same, adopt all the testimony, and me too.
Okay, seeing no further questions, that concludes this panel. I'll call up another panel that should hopefully sound like the previous one. Ashley Smith, Michael Burns, James Lanier, Matt Pavola. Jim, I see you up there. You can run up here and say me too.
I'm going to sit next to him. No, I'm going to sit next to him. No, I'm not doing that. Oh, come on.
Live on the edge. Go ahead.
I don't know if we're allowed to be seen in public together agreeing. This is James Lanier on behalf of the Maryland Association for Justice. We are a Me Too.
Ashley Smith on behalf of the Maryland Defense Council. Me Too.
Michael Burns on behalf of the State Uninsured Employers Fund. We agree wholeheartedly. Thank you.
Matt Pavola with MAJ as well. We agree wholeheartedly. We believe this
Jim.
will help the injured worker.
Matt, I see you in the back. You're like, I got you. Okay.
Thank you, sir.
Seeing no further questions, unless somebody wants to ask about random things, that concludes this hearing. Next, we will go to Senate Bill 227. Chair Bidle, I didn't think you were doing any more bills. I'm sorry. I guess my bills will die across the street. My
No,
bad.
they will not. They will not.
That's all right.
Thank you, Mr. Vice Chair and members of the committee. I'm actually here, 227 is a departmental bill, but your schedule says Chair of the Finance Committee, so unless there's someone here from the department that wants to present this bill, I think it's me. So thank you for this opportunity to come again. Actually, workers' compensation bill payment from the uninsured employers fund on 227 really just changes how they would do a return credit when there's an overpayment, like an employer begins to pay and UEF has already paid. It just makes for how they're going to handle the overpayment, and not as a credit to the insured, but or to the injured worker, but will just be handled internally as a credit. So it was a request from the administration and departmental bill.
Seeing no questions, that concludes this bill hearing. Now we go to Senate Bill 219.
Thank you again, Mr. Vice. That was 227. And next you said 219?
Yeah.
Okay. Thank you, Mr. Vice Chair and members of the committee again. You're going to get tired of seeing me. Senate Bill 219 is again on the uninsured employers fund. It's that additional assessment that I referred to in a prior bill. So this came in from the governor's office. It was going to be an increase of 1% to the employers that are paying workman's comp, but we decreased it down to 0.5. So now the total assessment is 1.5 to keep the UEF in good standing. And it also does a couple of other things. It says that they have to keep the reserves at a higher rate, and that they shall, not may, but they shall keep the reserves at 10 million. If it reaches 10 million, the assessment stops. And they can't have it go below, I think it's 5 million. And we added a monitor to help them because, again, they're in financial distress, and we want to get this back in good standing so that our good employers aren't continuing to pay this fee, this assessment that they're paying.
Seeing no questions, we have one other favorable, Carmine D'Alessandro. Go ahead, sir.
Thank you, Mr. Vice Chair. Thank you, Mr. Vice Chair. For the record, Carmine D'Alessandro with Chesapeake Employers and IWIF. I will adopt the testimony of Chair Bidle and urge support. And if permitted, Mr. Vice Chair, I will incorporate my testimony under 695. As I talked about, these bills are all interlinked. So we support 695 and this bill passing to stabilize the uninsured employers fund. Thank you.
Seeing no questions, we'll go to the unfavorable, Michael Burns. Go ahead, Mr. Director.
Thank you for doing that. Mr. Vice Chairman, honored members of the committee, I remain Michael Burns, and I remain, at least for now, the Director of the Uninsured Employers Fund. Briefly, Senate Bill 227. It's I spent months working with our attorney generals to come up with the original draft. There are significant amendments, which are all fine, except for the amendment dealing with sections L and M in the testimony. Briefly, you can have L and M together, or you can take both L and M out. But if you do not do that and accept the amendment that was submitted from the Senate, the claimants can get double paid, and the only way the uninsured employers fund can get that money back is if in the future there's worsening of condition and we have to pay for medical benefits or some other benefits, and there would be a credit. But there is no guarantee at all we would ever receive a credit. Having been an administrative law judge, I know of several federal programs where if you are paid twice, you have to repay the money, or you're paid by incorrectly, you have to pay the money. So that's a very important amendment, either both L&M or neither L&M. As to 219, you have our written testimony. I will note for you that this matter was the subject of the report that we filed with the legislature, with the Department of Budget Management, with the Subsequent Injury Fund, with the Workers' Compensation Commission in 2021, which a copy has also been attached to your testimony. The matter of the monitor has, for the reasons stated in particular on pages 7 through 10 of that testimony that we submitted in that report in 2021, is legally improper. The Workers' Compensation Commission, as those various quotes show you, is an adjudicatory body. They cannot have any influence over the day-to-day operations or oversight of the uninsured employers fund. That was the reason why the SIF and the UEF were separated from the Workers' Comp Commission. There are a number of quotes in there. Again, I would strongly urge you to do that because it's improper. Thank you very much.
Seeing no further questions, I see Senator Simon Ayer here. So Senator, I know you have Senate Bill 114.
Mr. Vice Chair, can I?
Sure, if you're on his panel. Do you like him? No, I'm not kidding.
I was actually, I was signed up for 227. That's the other UEF.
I don't think that we had any questions on that one, Jim. I think you're good. We're going to go on to Senate Bill 114.
Excellent. Thank you, Mr. Vice Chair.
You got it.
Thank you. It's a pleasure to be before you presenting Senate Bill 114, Veterans Notation on Professional Licenses. I want to thank the Department of Veterans and Military Families and the Department of Labor for working with me on this. Basically what this does allows veterans to have a veterans notation on their professional licenses. It's modeled after the MVA program where you can have a veterans designation on your license. The big difference is this is optional. The MVA is mandated, and I worked on this in the interim, and this allows the departments to have flexibility to have some departments implement it immediately, some wait till their software can be updated. It just gives them flexibility. If they do implement it, it has to follow the framework that is set up, modeled after the MVA program, where if they consent, then they'll also receive the benefits and services that are available to them from the federal and state level from the Department of Veterans and Military Family. Currently, we're only reaching about half our veterans through the MVA program. So there's many benefits to this program. One, I've worked on legislation trying to help reduce veteran suicide. As we know, there's 18 to 21 that commit suicide daily in the United States, and one of the factors is isolation. And by having this on their professional license, you'll have people come up and thank them for their services. You'll also have other veterans note it and then talk to them and probably network with that. And also, as we said before, it allows them to receive information on available benefits and services. Like we're passing legislation this year, it's hard to keep up on all the different benefits that the legislature has. And it also, quite frankly, is potential financial benefit. People like to hire veterans and repeat customers. They may even give them a tip, bigger tip. So there's no opposition, at least in the Senate, and there's no fiscal note, and the departments have been eager to start with this, so I ask for your favorable consideration.
Chair Crosby, members of this committee, thank you for the opportunity to testify in favor of Senator Simon Ayer's bill. I'm Dave Dragic, retired Army Colonel and Legislative Director for the Maryland Military Coalition. We strongly support this bill and what it does for the benefit of veterans by having the Department of Labor include the notation indicating the status of that individual as a veteran on an occupational license. Implementing processes for notating veteran status is an important proactive step. More importantly, incorporating the recognition of veteran status by the department's processes, assuming the individual consents to do so, reduces the burden on the veteran to prove his or her eligibility for state or federal benefits, saving them the personal time and effort to do so. As we all know too well, for the uninitiated, it can be a daunting experience working with any bureaucracy. So this proactive step makes it easier for those who have served other than honorably. So the Maryland Military Coalition strongly supports SB 114 and asks for a favorable report from this committee. We'd like to thank Senator Simon Eyre for sponsoring this important legislation and appreciate his leadership on the issue. Thank you.
Seeing no questions, that concludes this bill hearing. Senator Ellis, I see you here. We'll go to Senate Bill 148. While you're coming up, I know I saw Senator Hedelman, and I have not seen Senator Guile. Did she pop out? Okay. All right, go ahead, Senator, whenever you're ready.
Senator Crosby, members of ECM, it's good to be with you. Senator Arthur Ellis, representing District 28, Charles County, here to present Senate Bill 148, which is a cross-file of House Bill 0427. I want to thank Delegate Queen for the great job she did getting this bill through this committee unanimously. And basically, this bill creates a retired status for certified public accountants. CPAs, when they retire, they cannot use the certification, the initials, if they are not active doing regular continuing education, 80 hours every year. This bill is similar to legislation that passed in Annapolis, in MGA, a couple years ago for MDs. MDs had the same situation. They could not use their designation as medical doctors when they retired. So we created a retired status, a rental status for them, and this bill is similar. I therefore ask for a favorable report on Senate Bill 148.
Thank you, Senator. Seeing no questions, that concludes this bill hearing.
Thank you.
Next, I think we'll go to Senate Bill 284. Is Kenneth Brooks? I apologize. Is that a B? Okay, sorry, sir. And you're here on behalf of Senator McCrae?
Yes.
Okay. Do you have a panel, sir?
I do.
Okay, you can bring them up. Go ahead and start when ready.
Good afternoon, Vice Chair and members of the Economics Committee. My name is Kenneth Stooks, and I'm here in support of Senator McCrae, in support of Senate Bill 284, a measure that will combat the sale and distribution of alcoholic beverages outside of specific hours of operation through steep fines. The first offense, business owners of alcoholic beverages would be face a fine no less than $1,000 or suspension of the license. Further offenses would result in a fine of $2,000 and between $2,000 and $20,000, and the continued possibility of a license suspension. This bill, Senate Bill 284, protects our most vulnerable residents in those communities where alcohol vendors conduct the business to provide the least disruption to the community. And I urge a favorable vote on Senate Bill 284.
Good afternoon, Mr. Vice President. Excuse me. Woo! Mr. Vice Chair, I just gave you a promotion. I think that calls for something. Mr. Vice Chair, members of the committee, for the record, my name is Michelle Wurzberger. I am the Deputy Executive Secretary for the Baltimore Liquor Board. This bill is the least complicated bill that you will consider today. If they are open after their stated hours of operation, for most of them it's 2 a.m., 1 a.m., they will get if found guilty by the board, a $1,000 fine for their first offense. For the second offense, at least $2,000 up to $20,000. This basically says, look, this is important that you follow these rules. It's, you all decided their hours of operation for a reason. And that they have to do this. There's no wiggle room here. So for that reason, I ask for your favorable report.
All right. Good job. Seeing no further questions. Oh, I'm sorry. Got to hit that button. Go get him. No, I'm just kidding.
Hey, I promoted you.
Delegate Turner.
No, I'm taking notes. Okay, it says Baltimore City alcohol beverages hours of operation violation. What's the hours again?
So it really does depend on the class of license. So some close at 2, are 6 a.m. to 2 a.m. In certain areas, it is 10 a.m. to 10 p.m. It really just depends on the class of license and where it is located within the city.
Okay, class of
And just for the record, their license says when they are supposed to be open and closed. So there should be no mistake. They don't have to go and read legislation to determine when they're supposed to be open. Their license dictates that. So, and they're required to post it on their wall. So if they're following those rules, they should be able to understand when they can be open, ma'am.
they have to get the license before they have to go back and renew it?
Oh, it's an annual license. They renew it annually. We're in the midst of renewal right now. So for anybody who's listening, if you have a liquor license in Baltimore City, if you don't have the renewed license by May 1, you have to close. Yes, ma'am.
I'm talking to the Baltimore people.
Okay.
Thank you, Mr. Chairman. I get it, it's pretty straightforward, but why do you not want to give the board any flexibility in the minimum amount of the fine?
I don't think it's a matter of giving the board flexibility or not. What it says to the licensees is this is so important to us that there's no wiggle room. You cannot come up there and say, we don't want to hear the excuses. It's similar to, thank you very much. Yes.
It's an hours of operation, it's not. So is it really an issue in Baltimore City, I guess, that people are staying open later? How many offenses?
It is. It is an issue, and it's something that we hear from communities all the time about this. I'm joined here by our community liaison, and we constantly get messages on 311. We get messages to our liaison saying, look, this place is either opening early or they're closing late. They're having these private parties. You have to have a secret knock to get in. And we do investigations. We spend a lot of man hours investigating these types of situations. I think it's a matter of saying to the licensees, to the public, this is so important that you should know what you're going to get if you violate this law.
Okay, and what are the fines now?
It is for a first offense, no more than $500.
Okay. All right, thank you.
Yes, sir.
Private parties, could you help me with that? Why that?
A private party?
Yeah, I'm closed and I have a private party. You're saying I'm violating law then?
If you have a liquor license, you cannot have that private party on those premises. You can have it at your house, but you cannot have it on the licensed premises. That's that's the contract, essentially, right? You talked a lot about contracts today.
That's what your rule is, that private party cannot be in that.
That is absolutely correct, yes, sir. Yeah, you cannot sell or offer.
Well, you're not selling
furnish.
it, a private party's usually paid for, that's.
Yeah, you can't furnish outside of your hours of operation.
Okay, thank you.
Yeah, sorry, so I made a comment offline, and you're saying, just so that I can be clear with what my comment was, you're saying that this issue is as important to the board of in Baltimore as it is with selling to a minor. It's a no-go. And if you do this, then you will be fined. And that was the gist of my comment.
ma'am.
So I know I made that offhand. I mean, not being called on, but that's the seriousness of it because of the community concerns.
Yes, ma'am, absolutely. Thank you.
Okay. That concludes this bill hearing. Next, we will go to Senator Watson, Senate Bill 815. You can start when ready.
Chair. Good afternoon, Vice Chair Crosby and members of the House Economic Matters Committee. For the record, I am Delnay Gray, Legislative Director for Senator Ron Watson, representing District 23 in Prince George's County. I am here to present SB 815 that will provide a pathway for those with an arrest or minor nonviolent criminal history to become licensed for occupations under the Department of Labor. This bill would make an important step towards removing barriers to employment for those with past convictions and provide all Marylanders equal access to work with occupational licenses and certifications. In 2022, about 25% of civilian workers in Maryland held jobs that required practitioners to be certified and licensed. However, those with a criminal history often face barriers to obtaining these necessary credentials. The existing system disproportionately affects Black people, who constitute 71% of the state's prison population, despite making up only 29% of Maryland's overall population. The applicants would be required to disclose their education, training, and employment history that all may be considered. However, their criminal history may not be requested on the application unless it is a crime of violence, fraud, or is a direct or substantial threat to public safety, specific individuals, or property. After positive discussions with the administration and the Department of Labor, Senator Watson amended the bill to limit the professions under the Department of Labor that the bill will cover to the following 6 areas: barbers, cosmetologists, electricians, plumbers, heating, ventilation, air conditioning, and refrigeration contractors, as well as home improvement contractors. However, the Senate Finance Committee further limited the licenses to cover only barbers and cosmetologists. It is disappointing that more professions were not covered. However, it is a step in the right direction, and this bill does not have any fiscal impact, and we respectfully request your favorable report on SB 815.
Good evening, Mr. Vice Chairman, members of the House Economic Matters Committee. My name is Mark Woodard on behalf of the Job Opportunities Task Force. I first want to thank Senator Watson and his excellent staff for work on this bill in the Senate and here today. There's such an excellent job of summarizing the bill. I just have a couple of additional points. One of the problems that we have here in our state is we have tens of thousands, if not 1 million people that have arrest or criminal records. This follows them throughout their life. It frequently is a barrier to them being able to find employment and move forward with their life. This bill creates a pathway to make it easier for some people who want to become barbers and cosmetologists to be able to do so. And of course, that's very important to them as individuals, but it's also very important to all the rest of us, because then they become part of the workforce and they become part of the tax base, and they become productive members of society. The Senate Finance Committee, in its wisdom, as has been stated, narrowed the focus of the bill even further. We asked for a favorable report, and we respectfully request we offer the opportunity to answer any questions that you or the committee may have. Thank you very much.
Sir, just a question for you. I mean, we have members on this committee that seem to bring bills very similar to this and on this topic. There's no House cross file to this one, was there?
No, there's no House cross file to this bill.
Okay. Seeing no further questions, that concludes this hearing. Senator Heddleman, I saw that you walked in. Oh, I'm sorry. Did you want to ask a question? All right, don't go nowhere. That does not conclude this hearing. Back it up. Delegate Boafo.
The question is really for the senator. I'm not sure if he's allowed to.
CT's not here. Ron, you can come up.
Thank God. Good to see you, Senator. The question I have is, and your aide just kind of mentioned this, the bill was amended and took out some other things that were in the original bill. Can you talk a little bit about that?
Thank you for the
Why that
question,
was?
Delegate Boafo. And I want this committee to really clearly understand. We've talked about giving folks second chances and allowing folks to put the past behind them and move on. But what was really disheartening when we went from the 5 areas down to 2, and when I inquired why, is because many felt that they did not want someone who was a thief in their home. They didn't want someone who was a thief in their home, somebody that stole something. They didn't feel comfortable. So they struck the bill down. We have to really make the hard decision on how serious we are about giving folks a second chance. And I hope, as my intern said, this is a start. But we do plan to work on this and add some other areas as well, because, you know, you do your time. We narrowly focus this to nonviolent crimes, nothing to do with fraud, and they still narrowed it down. So that's the answer to your question. Thank you for it.
Okay, seeing no further questions, that concludes this bill hearing. Senator Heddleman, you are here, so we'll go to Senate Bill 846, and you can start when ready.
Thanks again. Good luck.
Good afternoon, Mr. Vice Chair, members of ECM. I am Shelley Heddleman, and I am here today to present to you Senate Bill 846, which does not have a cross-file. This goes to an issue that I faced this summer, and I'm guessing that many of you may have faced a similar issue. So I'm going to tell you a story. I hate going to the cell phone store. One of my least favorite activities. I set aside like 2 hours of my day. I decided I needed to go to the store, wanted to go to the store. I have thousands of photos. I just want, I'm not that tech savvy, I'm okay, but I wanted, you know, the guidance of the phone store folks there when I bought a new phone. I needed a new telephone. So I go to the cell phone store. My account is primarily in my husband's name, but my name is on the account. I had his password, I had everything I needed. I go to the store and I say, I want to buy a new phone. Please, can I have your number, your account? They look it up and they say, oh, I'm so sorry, you cannot do that. And I said, I'm sorry, what? They said, you cannot purchase a phone without your husband physically being here in the store with you. And I was incredulous. And I said, I have his password. I can get him on the phone. We work, like, my name is on the account. We live together. We're happily married, etc. They said, we don't care. He has to physically be here with you. We just instituted a new policy because it has to do with fraud. And I said, well, I recently changed from another company that shall remain nameless. I said, they didn't have that policy. I'm so sorry, that's our policy. Can I speak to a manager? Yes, you can speak to a manager. Same thing. I said, okay. I tried to open a new account. Sorry, you can't do that. I said, okay. So I said, let me see if I can talk to somebody in this company. I leave the store and I call and I make my way up to the VIP person there or whoever that handles special cases. And I said to I explained my story that I just shared with you. And they said, we're so sorry to hear that. We had to do this because of fraud. And I said, they said, well, we have his social security number. We have other things. I said, I earn a living. I have a salary. I'm happy to give you my social security number. I'm happy to give you any information you need so that whatever fraud issues there are, they would be with me too. I'm so sorry, we can't help you. And I hung up very frustrated and I said, this isn't the last you're gonna hear from me. Let's zoom forward a few months. I post this on social media, just like I explained to you, and I said, does anyone else out there have a similar story? I got 100+ responses from many people. And one of my constituents, or not a constituent, somebody I do know though, shared her story very briefly. She couldn't be here today. She is married, had moved, tried to do the same thing, and she explains it very briefly in a few paragraphs in your testimony. Her husband has Lewy body dementia. She explained that to the person at the store, and they said, sorry, he has to be here with you. She took him, had to go physically bring him into the store. She even had power of attorney, and they said, sorry, he needs to be here. She went, and that was the only way that she could make a change. So this bill would fix that problem, and it would say, and as amended, we got the lawyers together to come up with the right language, that you have to include an option in the service contract that allows more than one individual who is a customer of record to alter, modify, or cancel the service contract without the agreement of the other person if all of them agree in writing to the option of the execution of the service contract. So I don't know how many, maybe some of you have had a similar situation, but I found it infuriating, infantilizing, etc. And so this bill is meant to help and address a very practical problem that so many of us and our constituents face. I thank you for your support and happy to answer any questions you may have.
Thank you, Senator. So is this standard amongst all carriers or just this specific carrier that was?
I do not know the answer. I have had other people in Annapolis tell me that it wouldn't have happened with their company. I will tell you that, but this applies to everyone.
Okay, and is all of those folks?
No one has opposed the bill.
Okay, so I'm gonna ask you a question, and if you really don't want to answer it, then you can answer out in the hallway later, but everybody is on the edge of their seat and they all want to know the
Xfinity.
Xfinity.
I said it in the other hearing, so, and it's not a secret.
A big X.
Xfinity is the company.
Thank you.
I mean, yeah.
Senator, for whatever it's worth, I mean, I think AT&T, Verizon, I'm pretty sure, this is not unique.
I'm
What is
guessing it
unique
is
is
not.
I have not heard anybody going into a cell phone store, like most of us just call up or order online.
I'm a
Diane
dinosaur,
Harrison.
what can I tell you?
She's getting ready to ask you if who's coming up in the store.
Oh, I was going to ask, had you filed this before? Because it seemed like deja vu, but I actually read it. You posted it.
I posted it.
And I read it. And I was infuriated because to me, it sounds incredibly sexist. And I'm just going to say it. It sounds incredibly sexist. And so I don't like it.
Amen.
I don't like it. You know, we fought hard to get where we are, what we've accomplished. We've still had a long way to go as women.
Yes.
And so I don't like it. But I had a phone last week and I took my husband to the store because he pays the bills.
Well, I will tell you.
But it was a 4-hour process.
It is horrible.
And I left him and went to an event and came back.
I did say, I will add, I will say, I didn't share that I also believe it is sexist, and I said that to the person in the store, and I said, and I bet, you know, however many, 8 out of 10 people have their husband as the primary person on the account. I have since learned there are many people who do have the wife or the female partner in the household, and I have had men tell me they felt emasculated when they couldn't make the change. So it varies, but yes, I think it is an antiquated and sexist policy. So.
Thank you. I hate to prolong this, but it seems like we had a similar issue with like electric utility and gas accounts and stuff. Do you know, is this specific to cell phones?
This is specific to cell phones.
I know the bill is, but do we have that same issue with
I can't speak to that.
Okay, thank you.
Let's call the utilities up, have some fun. All right, I think that no further questions. That concludes this bill hearing. Thank you, Senator.
Thank you.
We'll next go to the final bill of the day, Senate Bill 771. Senator Guile. Sir, do you have a panel with you, or is it just you? Alone and unafraid in house?
I think I can handle it.
All right, move on favorable. No, go ahead, sir.
Mr. Vice Chair, members of the committee, for the record, Spencer Dixon, Legislative Director for Senator Don Guile, here to present SB 771 that did not have a House cross-file. This bill would restore parity to the rental and peer-to-peer market by making the insurance of a peer-to-peer vehicle driver the first sought in an at-fault situation, just like a traditional rental car or personal vehicle driver. To provide some background, peer-to-peer refers to a service when one person has the use of another person's vehicle for a period of time in exchange for payment. This transaction is facilitated by a peer-to-peer operator or platform. The customer and the vehicle provider are connected to the service via a website or a mobile application. Under current law, if a driver of a vehicle engaged via a peer-to-peer platform gets into a crash, it is the insurance of the peer-to-peer operator that is sought first, ahead of the driver who calls the fault. This is out of line with current adjacent industry practice and with national model policy. The peer-to-peer industry in Maryland has been steadily maturing. In 2017, the Maryland Insurance Administration issued a report shaped by a broad range of industry and government stakeholders to update the statute and to keep it in line with industry and consumer practices. Who should have primary and who has secondary coverage in the case of a crash was a subject covered by the report in 2017. So here's where SB 771 comes in. In response to those recommendations and in line with national model policy, this bill places the vehicle's driver's personal insurance policy as the primary source of motor vehicle liability insurance in the case of a fault by the driver of a peer-to-peer car rental. This bill does not remove a peer-to-peer operator from liability. It simply aligns the law with almost every other case where a driver is at fault behind the wheel, in making the driver's insurance the payer of first resort. If a driver is without insurance or improperly insured, a peer-to-peer master policy would then be sought. Under this legislation, the driver, the car owner, and the peer-to-peer service must all be properly insured, just like a traditional rental car or personal vehicle. If the car owner or driver is found to be improperly insured, the peer-to-peer operator would still be liable. This technical change will allow the industry to more comfortably mature in parity with market partners. Language requested by the insurance industry and the regulating agencies was added to the bill prior to introduction. Per the fiscal note, enforcement for this bill can be handled using existing budgeted resources. Additionally, special fund revenue would increase minimally. I would also note there was no opposition at the Senate hearing, just as there is in this hearing. And the bill passed the Senate unanimously. And as I mentioned, there was no House cross-file. So for these reasons, I respectfully request a favorable report on SB 771.
Good job, Bud. For the record, we didn't let anybody sign up. Oh. I'm only messing with you. Delegate Frazier Adalga.
Thank you. So
no submitted written testimony in opposition.
So maybe I misheard you, but I came away from your testimony with the impression that perhaps there were two different standards. If someone rents from a peer-to-peer network like Turo, and they do not have an automobile, so they do not have automobile insurance, what happens?
It's my understanding that it would be Turo to pay that, but I do have industry represented here to confirm. But it's my understanding that Turo would be liable in that situation.
So would they have to pay, would they have to, like, when you rent a car traditionally from like Avis or Enterprise, where you get the opportunity when you're signing up to either have one insurance company or your own insurance company? So you saying that what would happen would be you'd go to Turo, you'd sign up and you'd say, I don't own a car, I don't have a car, so I'm going to use the Turo insurance, and then you'd pay for it and they'd provide additional insurance?
So I think we're talking about two different types of insurance. There's the insurance that is covered for the driver, and then there's the insurance that Turo holds in cases like this. And what this bill does is provide parity so that the driver at fault is the insurer of first resort, whereas right now, Turo is the insurer
Right,
of
but my
first
question is, what if the driver at fault does not have an insurance policy? Who covers the claim?
Yeah, and we can have someone jump in from the industry, but from a consumer standpoint, I've used peer-to-peer before, and you are required to show your license, and I believe you're required to indicate how insurance is handled.
Is there some, sir, I see you back there jumping up and down. You look like you can answer a question. Okay, come on down. Don't bid over the number. Go ahead.
Hello, for the record, my name is Keith Wormsley here today on behalf of Turo. So, Delegate, when you go onto Turo's website or use their app currently...
A little closer to the mic, can hardly hear you.
Oh. Currently, you will be appended to Turo's master policy at the point of rental.
So do you pay extra for that?
It is in your rate when you rent your car.
Okay, so but what if you have your own insurance? Then you get a discount?
No. So currently the law requires that the driver, the car, and Turo are all insured, and that remains under this bill and would remain should this bill become law.
Okay, I'm sorry. Maybe I'm not. If I have car insurance already, what this bill does is make that the primary insurance should there be an at-fault accident.
Yes.
What if I do not have car insurance?
If you do not have car insurance,
and I rent a car with Turo,
then you would be appended to Turo's master policy, and that policy would be considered primary.
Okay, in the case when that happens, like with an Avis or Enterprise, am I then subject to an additional fee to fall under the Turo policy?
I don't believe so, but I will double check for you.
That would be good to know, because then you theoretically could just say you don't have car insurance, not have, you see what I'm saying? Like, that's a big hole in this whole.
Well, the law requires you to tell the truth.
Okay. But you see what I'm saying?
Well, current law and this bill would both require you to tell the truth. I'm not sure that what would happen if somebody was found to be lying, but the law requires you to be truthful.
Okay, thank you.
How would that differ if I rented a car from the airport and their insurance? Would this put that in line with it or be different? Okay.
It would be in alignment.
All right. Seeing no further questions, that concludes the bill hearings for today. We're going to take a 5-10 minute break, and then we'll be back on for the energy work group. Thanks, everybody.
Thank you.